I'm in search of conversation guests. If you are interested or know someone that might be interested, please contact me directly. Thank you. Started on how was your day?
Today was actually pretty decent. Yeah.
You went to work?
I went to work. So I only work 7:30 to 2 on Fridays, which is bomb. I love it. Which is great in my profession. Like you kind of pretty much choose what days you work. So yeah, I was off at 2 o'clock.
Is that because why do you get to choose the hours that you work?
So dental hygiene is predominantly female. And so, between...
That sounds unfair to the people that work 9 to 5.
It's not. Oh, for people that work 9 to 5?
Yeah. What type of privilege are you getting that we don't get?
Interesting question. Not a whole lot of hygienists are like full-time. They'll do a couple days in one office, a couple days in another, which is kind of nice. You kind of avoid office drama, that sort of thing, if there is any. But yeah, and so you can work 2 days a week, 3 days a week, 5 days a week, 6 days a week. I know hygienists who have done.
Is it common?
Very, very common. It's uncommon to be full-time Monday through Friday at one office, which it's uncommon that I actually have that position now.
So I guess you'll have to, the more I do these conversations, the more I understand so little about everybody's jobs. I mean, even I would, from the outside, if I were to think of a dental clinic, I would think that it's still a 9 to 5 type of situation. Why is there?
So for assistants that work there, yes. For the dentist, most likely, yes. If the dentist is the actual owner, yes. However, dentists can hire associate dentists who only work a few days a week. So it depends on where you go. But hygienists, like I said, generally don't work Monday through Friday at the same office because I don't want to... a lot of dentists don't have health insurance for hygienists because they're kind of like their own contractors, basically.
Okay, independent contractors.
Yes, kind of. Yeah, depends on the situation. Some are paid $10.99. There's been situations where I only got paid through $10.99. But yeah, that's pretty much how that goes. Yeah, so which is really cool. I mean, I've enjoyed it my entire career. So yeah.
So Fridays 7 to 2 because you choose.
Well, actually, I take it back. He's only open until 2, my current dentist, which a lot of dentist offices are only open half days on Fridays. Some are full. Some are crazy and go Monday through Saturday. Some are super crazy and are 7 days a week. And then they have several different hygienists, several different doctors working in the same facility. So, yeah.
Okay, what is a hygienist?
What is a hygienist? This is a question I love to answer because I got asked this question last night as well, because not many people, even when they walk through the door and sit down, they'll ask, there's 3 different people 4. You've got the front office who answers phones and whatnot. You've got the dental assistants who assist the doctor, take x-rays, that sort of thing. So that's generally the first person that you see, usually. The dental hygienists, we have to have a degree. We have to be licensed within the state of Nevada. We have to keep up that license every year. And then there's the dentist, and they're the ones that actually fix the teeth, crowns, fillings, root canals, all that fun stuff. However, with the hygienist, we clean your teeth. We measure your gums. We look at how much bone loss you have going on as far as the bone that's holding your teeth in. Our specialty is very specialized at cleaning. I'm trying to think. Our entire degree is focused on your cleaning. So,
when I go to the dentist, they don't the hygienist. I don't ever remember them saying that they're the hygienist, but they wouldn't need to, right? The person just sits.
If you're there for cleaning, generally that's the hygienist you're talking to. If they get in your mouth, and they're generally, if you're there for your cleaning. If you have an appointment for a crown, you're not going to see me. You're going to see the assistant and the doctor, and that's it. So that's generally how that works out.
And it's just so seamless that the normal people would never even know there's
really
a difference.
know the difference.
Yeah.
They never usually do.
Okay.
So, and a lot of times the assistant, they'll be like, are you the one cleaning my teeth? Or, that sort of thing. So, yeah. But once you go consistently, and if if you have a dentist office that you go to consistently, your hygienist. Because there are people who are very particular about what hygienists they see. Because not everyone is, how should I say it, compatible. Like I like to think everybody loves me, but they don't. So in my particular office, which is unusual too, we have, not completely unusual. I usually, in my previous offices, have been the only hygienist with all of the patients. But in the office I'm at, I'm the fourth one there.
What's the average or typical, like if there's a dentist office with one dentist, I guess a small office would be one dentist, maybe one assistant, and then one hygienist, and that'd probably be the smallest.
The smallest, yes. And I've worked for an office where it was one. No, I take it back. I had the first office I worked at out of school. It was the doctor, and he was the private owner, because you've got corporations and you've got private ownership. It was a doctor, his one assistant, and then actually he had I want to say 5 or 6 hygienists, but again, 1 day a week here, 2 days a week here. There was 2 rooms, but everybody had different days. So, yeah.
Okay, so still, okay.
Yeah. So, yeah, a smaller office on a smaller scale, yes. But you can go to huge corporations where they have 20 rooms. And then you've got 5 different associate dentists, like Pacific Dental Services, I think is one of them. Well, they have 5 different dentists, and then all these hygienists. You have an office manager managing everybody's schedules. Everybody has different, because basically when you look at a program for a dental office's schedule, the dentist has, 3 columns, and then the hygienist will usually have 1. I generally, in most offices, have 2 columns, because I usually work with an assistant, which is kind of an unusual situation as well. So,
what's the point of them doing independent contractor hygienist? Is that's the norm?
No. So you usually have the W-2 situation. Usually, 1099 isn't something that's super common, only because so the situation that I work part-time for an endodontist. An endodontist is a specialist who, because there are specialists in the field. You've got the general dentist who has his 4-year degree. The specialists go in for another 2 years for their degree, and they can branch off into doing just root canals. That's an endodontist. Or doing just braces. That's an orthodontist. Or, that sort of thing. So I work for an endodontist on occasion, and he basically has me go through, because we're licensed also to give injections for anesthesia. One of my favorites. Anyway, and so I'm under a 1099 with him. So,
I was going to say, can you abuse your rights? But we probably shouldn't say that on camera.
No. So I go ahead of him just for mostly for time reasons, and numb the patients up. So as soon as he's finished in one room, he can pop over to the next one and just get started, instead of waiting for the anesthesia to, getting them numb, waiting for the anesthesia to get take effect, and then starting. So I was just right ahead, and I love doing that. But in that particular situation, he works out of state, has his license here, but
you love putting people under, or is that when you
no?
said you
I
love
doing injections and jumping into,
Okay.
I like fast paced. I love my job in general. It's so weird. And I get so many people who are like, oh, I can never do your job. Yeah, well, if you're not, I'm the one doing it.
And then there's the people that hate going to the dentist. They fear going to the dentist.
100%.
Yeah.
And there's a lot of justification especially a lot of older patients, my generation and up, because when they were younger, dentists they didn't have much of a bedside manner. And so there weren't as many dentists either, like there is now. And so they had some very traumatic experiences where they had teeth pulled without any anesthesia, or they were held down screaming again, So they have a very justified fear coming into the dentist, and their entire demeanor will just change. No matter how nice they are outside, the second they walk in. And it's usually those people who wait forever until they're in like extreme pain to actually come in to the dentist. So yeah, there's a lot of different people that we do have to deal with, personalities, issues, stuff like that. So
I think
then there are people who just hate coming to the dentist only because they just don't take care of their teeth. And so it's always a situation every time they come. And we always get, and I'm sure you've heard that statistic where dentists, there's a higher rate of dental suicide than any other profession, because every time they walk through the door, it's like, oh, nothing against you, but I hate being here, or I hate what you do, really, because I love what I do.
Yeah.
And nobody's forcing you to be here. And do you think I really like hearing that? I don't. So, yeah.
It would be better if they just said, hey, I'm fearful of just things getting done in my teeth. I think that'd be easier than saying
100% better. But it also, with each and every patient that comes through, I try not to really judge what they're, saying or coming out of their mouth, because everybody has different backgrounds that they're coming from, and different experiences from where they're coming from. There are rude hygienists, unethical ones. There are rude dentists and unethical ones. They may have come across them and have had to build that kind of demeanor to even, be where they're at. So I kind of have to go that route for today. For instance, I had a patient come in, and she was just, we were talking about her cleaning, and she's like, yeah, I've had laser cleanings before. And I'm like, yeah, those are great. And she's like, well, my dentist in Cleveland, she's my friend. And she was telling me that they're nonsense. I was like, actually, no, they're not. They do help you. And I'm very straightforward with my patients. And, I was saying something to the effect of, well, when I see you at your next appointment, or when your next appointment when you come, she's like, well, we'll see about that. And this was before I leaned her back. So I went through my entire spiel, because I like to educate my patients before I do their first cleaning, especially if they're a new patient. And so leaned her back, did her cleaning, was about to say goodbye. She's like, I get you next time, right? And I was like, yeah, I guess you're coming back. I didn't say that, but I was like, okay. Yeah. But it's just, sometimes people just come in with their attitude, and, like I said, they're different backgrounds, different experiences that they have, different information that they get from their friends who are dentists or friends who are hygienists, not to bash any other, professional, I should say. They come in with that kind of attitude, and they're guarded, and they think, which is understandable in this town. There's a lot of, what should I say? People who want to push for the money, that sort of thing. So I kind of get it, but at the same time, it's like, give me a break, give me a chance. I'm just trying to help you, you know. So
when I worked at IBM, kind of similar, where a lot of the people didn't like the IT people, and I was coming through upgrading the hardware, and you'd get people like, hey, don't touch my machine, or they know it's upgrade day, and they're like, well, do whatever they would say. It's kind of mean, like, do the least you have to, or like, I need it, or they would say, I need to be back on by 1 o'clock. I'm like, well, we're trying our best. Like, we gotta.
I'm doing my job.
Yeah.
Chill down, bro. It's okay.
So I would take the approach and explain everything to them. I would get too technical with them sometimes, just to kind of. Not that I'm trying to make them feel dumb, but just trying to explain everything. Like, hey, this is the script we're doing to back up your data. We're moving this data over here. And then when you get the new machine, we're putting this other new software, and then we're going to move that data in, that, and that. And actually, so I worked at IBM. I think our biggest client back then was Union Bank of California. And those clients always request me to come back to do their sites.
Well, when you're personable too, that makes a huge difference.
Yeah,
and they don't see you as just that computer guy.
Yeah.
They see you as Liem. And it's like, oh, okay, it's that guy.
Yeah.
I'll have him come back. Yeah. So that's another thing too. It's that, treating them like a human being and making them realize I'm a human being too makes a huge, huge difference.
Is there something that a new, do you call it client or patient, or what do you call
patient?
A new patient that comes in, what can they say that would be nice to a hygienist, a dentist, or instead of them coming in just being like, "Oh, I hate being here. I don't want you to work on my teeth." What's the nicest compliment you've had besides like something superficial, something
okay, so not every patient's like that. There are a majority of patients are not. It's those sticklers that kind of like will irk your day, you know, or if you let it. So, but a majority of patients aren't. The other day I had a patient and I was just walking out and I just, you know, called his name and I was like, "Hey, you ready? How was your day?" And he just looked at me. He's like, "Wow, you have great energy." He's like, "I'm glad I came today." So I was like, "Cool," you know, so.
Yeah.
And there are patients that I've had so many times and it's just laughing nonstop. And it's like, "Hey, you need to shut up. We need to get through this. Okay. I'm going to get in trouble." I'm not, you know, so, you know, which is one of the many reasons I just love what I do, because you get that, almost family kind of friend relationship with some of your patients. And there are patients who have become friends, you know, after I've been seeing them for so long, that they'll follow me wherever I go, you know, because they trust who I work with and they trust that I'm going to work with somebody ethical, you know, which 90% of the time I have. And when I found out that I didn't, I would leave. But So when they walk in the door, you know, just patients in general, not being in a bad mood is great. Not showing up late is amazing because we're on a time crunch. Like, we only have 1 hour with you. Can you show up right on time? Or they'll show up. My favorite is when they show up late and I race them back and they're all the way back in my room and they sit down and they're like, "Can I use the bathroom?" No. You can't. So then they have to get up, take them to the bathroom, wait for them to use the bathroom, and then call them all the way back and then, you know, get started. And then it's like a million questions, you know, "Well, you know, I can't lay all the way back and I can't," you know, it's just like, "Okay, all right." But at the end, it's always, "Make sure you do a really good job." Well, since we missed 3/4 of your appointment, let's, you know, so yeah, but as they walk in, just having a great attitude in general, or just, I understand people can have a rough day. I'm not the cause of it. Please don't, you know, throw it at me. If you come in and you're like, "I've had a really tough day," totally understand. You know what? We'll skip the x-rays today. Let's just do what you need to get done. Let's get you out of here. Let's get you on your way. You know, totally cool with that. If you come in and you're just, because, you know, there's been a few patients where I've had to sit back and be like, "Hey, I'm a human being here. You're being very confrontational. I'm not comfortable with this." And they've usually at that point have been like, "Okay, I'm sorry. Yeah, you're not being a decent human being right now."
Yeah. So bad people, and then good people are just
I
just
wouldn't
come
call
in.
them bad people. People
I
with
would.
bad experiences are people with that, just that day. I mean, we've all had tough days.
Okay,
I mean,
can I ask?
Yes,
this
you
might
can.
be or I don't know. It might sound bad. How many? What's the percentage of kind of evil, mean people, not nice people, and then what's the percentage of patients that come in and that are actually pretty cool?
I would say 10%, and they all come on the same day. So
Monday?
They all seem to. No, I don't know what it is.
Oh, it just happens. Like, it feels like it's the same day.
Feels like they're all coming the same day. I will come in with the most upbeat attitude. I'm like, "What did I do?" And then, you know, okay, get rid of that patient. This is what I love about my job too. It's only an hour per patient. So if they're awful, then it's just like, okay, it's only an hour. But if there's several in a row, it's like, whoa.
10%'s not that bad. I was thinking it was going to be closer to like something 80 or 60%.
No.
Okay.
Majority of my patients, they're pretty great. They're pretty, and I get pleasantly surprised by some people too. Like I said, when I was talking about the patient earlier, she was kind of grouchy and kind of, you know, attitude. And at the end, you know, "Can I have you next time? I love it. You know, you did a great job cleaning my teeth. They feel so clean," you know, and I'm like, "Oh, okay." And so that bad situation can get turned around. So,
yeah. Do you think it's any different on the dentist, orthodontist, or I'm guessing it's probably the same percentage, orthodontist, dentist, and or hygienist, like getting bad patients? It's probably the same number.
So no, not necessarily. So a majority of patients that come and see me, they're usually there for routine cleanings. On occasion, if they have pain, they'll wait for the cleaning appointment to let me know. But normally, when they see the dentist, it's they already in pain. So that kind of exacerbates the situation a little bit.
Oh, okay.
Or they've had to, they're having treatment of some kind that was not what they were expecting. Nobody expects to have cavities. Nobody expects to walk in and be like, oh, you need 3 crowns, or, usually there are people who have like bombed out teeth. They're like, I know this is a mess. Let's just clean it up, and then they're happy to come in and just get it done and get their teeth back in order. Now, when you talk about the specialties like orthodontists, they deal with kids and teenagers, give and take, the endo guys that do root canals, they probably have much worse because people are in pain. Yeah. Root canals, when you have to get a root canal with a specialist and not the dentist, that means it's a lot more money. There's oral surgeons, which means like they have to take their wisdom teeth out, but that's probably a little bit easier because they just knock them out and do their stuff. They don't have to hear anything. So yeah, I would say for the dentists and other professionals, yeah, they deal with a little bit more than I do. A lot more complicated procedures, a lot more expensive procedures too. So yeah.
I'm going to ask another question that maybe will get me deplatformed. Not really deplatformed, but so if someone...
Or is it going to get me deplatformed?
No, maybe it could. If someone's like 70, I think they're 73 years old.
Yeah.
And they want to, their teeth aren't doing so well, so they want to go in and get like a whole, like brand new teeth, like fake teeth.
Set of dentures? Dentures or fake teeth? Or are you talking about implants?
I was thinking I think they said implants.
Okay. So you're asking a specific situation here.
Now,
okay.
I'm thinking someone that's 73, should they spend that amount of money? Because if they're 73 already. Now this is a mean thing to
ageism.
Say. Yeah. That's why I should be deplatformed. But so in your personal, outside of professional opinion, how would you view that if that was you? If you or you knew somebody that was that age, should they go and spend that much money when they don't take care of themselves that well too? So
every situation is completely different. I mean, why not? It's their money. If they want to invest in their teeth, you're looking at a pretty huge amount of money if you're doing there's implants for like usually if they don't have any teeth, they have implants, what's called an all-in-4, where basically it's implants with a permanent denture on it so that it's super stable. Very, very pricey. But yeah, if they have the money, I mean, just because they're 73 doesn't mean they don't have the money to do it. Maybe they do. But without finances aside, at 73, to be honest, if their teeth are a mess, are their teeth a mess to begin with?
I don't know.
I'm assuming they are if they're getting ready to go that route.
That's what it sounds like.
So they haven't taken care of them, and they're like, whoa. So without teeth, with just, if you don't have all of your teeth, you're not usually eating correctly. If you have regular dentures, you're usually not, because regular dentures are like basically 2 pieces of plastic that you're trying to eat with. So somebody who gets all their teeth pulled and have regular dentures, their nutrition is going to go down because they're going to go to softer foods. Therefore, their general health is going to go down. So 73 isn't super old. So I would say, yeah, go for it. If they have the finances and the means, then by all means, they should do it. Go for it. Because then they can eat what they want. If they were in pain from, tooth problems before, they're not going to be in pain anymore. There's still maintenance involved. And that's something that we're really huge on our patients who end up having to get something like all-in-4s, dentures. It's like you still have to take care of these. However, putting that kind of investment in it, they're going to take care of it, because they put a lot of money in it, because there's a chance of that failing, because when you have an implant done, it takes months. The whole process is months. We have to basically pull out a tooth, put actually a bone graft in there, which is like bone granules for the bone after wait like 3-4 months for the bone to really harden and get together to be able to drill that implant in and hold.
Wow.
So it's a huge process and it's very expensive. So more likely than not to say that I haven't had patients who didn't take care of it, because there are, but they're going to take care of it for sure. So yeah, absolutely. I think they should.
The other side of that conversation, I was thinking, if they're already 73 and if they're not taking care of their body very well, like, is it worth spending that money? I totally
again, case by case.
Yeah. I totally understand.
Are they flipping a new leaf and they're like, or if they're not, that's a hard one to say because
I'm a jerk for asking like this.
Not at all. It's an interesting situation. But to each his own. My profession is about health. And so we would like to think that that person is going to start taking care of themselves. I have seen many people, not a ton of people, but I have seen many people put in a lot of money into their mouths and then they come and get their cleaning done. And it's just like, what are you doing? Because on my end, it looks like nothing, and I will even say, I'm kind of one of those hygienists, I think because I've been doing it so long, or personality or what, but I will call people out. Like, how much investment you put in your mouth. Like, you realize by not cleaning this, all of this can fail and you can have decay again. You can, what's your choice? I mean, even I have patients too, they'll come in, and this is irritating as well, talking about patients that are frustrating. They'll come in, they haven't had their teeth cleaned in like 3-4 years. I just want my free cleaning. Yeah, well, when I measure your gums, because I go through and measure the gums to see how tight, so this is your tooth and this is your gum, to see how tight the gum is against the tooth. If there's an infection, that gum will just separate, and if that hole is just deep, that means the bone that's holding it in is super low. And so eventually you're going to lose your teeth unless you get in there, get it all cleaned out, which is considered a deep cleaning. I don't know if I'm explaining that enough in layman's terms for you. But if you clean it all out and stabilize it, you can make it so that you can keep your teeth. Mm-hmm. And so I'll have patients that'll come in, you wait all these years and they come in, they're like, I just want my free cleaning. Okay. Which is so like, you realize, okay, so you want me to kill myself and take off 4, 5 years, 10, 20 years of buildup that you have sitting on your teeth. You don't floss, you brush once a day, maybe. Let me just kill yourself for your free cleaning. No, that's not going to happen. My time is way more valuable than that. I am not going to, no, it's not going to happen. And I've had people just storm out like, oh, you're not going to give me my free cleaning. Yeah, you're not in that, what should I say, in that category for a free cleaning. When people come in every 6 months, because that's all people have in their mind. I need to come in every 6 months for my free cleaning. Well, those people are people who actually brush their teeth, floss their teeth, keep them fairly clean. Some aren't so great at it, but at least they're consistent coming in. So when they come in and I have an hour to get all of that off, that's what that hour is really meant for. And then people who come in with just all this buildup on their teeth, I'm like, yeah, not happening. You need a deep cleaning. We need to schedule you for that.
How long is it?
So deep cleaning can take anywhere from an hour to 2 hours per side of the mouth.
Wow.
Yeah. So, and that's where I have to numb an entire side of the mouth. There have been on a rare occasion where I have to do it numbing it because some people are just like, just get it over with. I just want it done, which is fine. Your whole mouth and your tongue is going to be numb. So it's a very involved situation, and it is substantially more as far as financially. However, I'm still going to kill myself getting it done, but I'm going to have the time to do it. I'm going to have you numb. It's going to be in a situation where we're both aware what the outcome is. Not only that, you put that investment in yourself. That tells me, hopefully, you're going to stay on it and keep on it and keep it clean. Hopefully. Doesn't always happen, but hopefully. So, yeah.
So you mentioned flossing. What's your? I think one of the questions that you added in there was your thoughts on flossing. What was that about?
My thoughts on flossing.
I think that's what was it?
Well, whether you're going to get it, whether why
is it
I'm a
important
dental
to floss?
hygienist. What do you mean? Of course, I'm going to tell you. My thoughts on flossing: absolutely, you should floss. That's like when you go take a shower. I mean, do you clean your butt in the end? You know, of course you do. Or do you just leave it and just clean all the outsides? It's kind of the same thing. You've got your teeth, you're going to brush and clean the outsides, but where they touch.
Yeah, the crack.
The crack. Do you clean your crack, Liem? I hope so. So, yeah, in that crack, you got to keep it clean because otherwise bacteria is going to build up in there, and that's where you have issues. So many people, a majority of, cavities happen in between the teeth or on top of the teeth, like in the back teeth where there's deep grooves. It's usually there or in between the teeth because the top ones, there's only so much you can do, but the ones in between, just floss.
Yeah.
And I'm a huge advocate for the water pick, which is a water flosser. I don't know if you've ever heard of those.
No.
Okay. So basically it's a machine with a tank. You can pop the tank off, fill it up with water, pop it back on, and then it has like a cord and a handle, and it just basically, it's like a pressure washer.
Okay.
Just getting in between. And I even, honestly, if you floss and then use the water pick, you'd be very surprised at how much extra comes out. And so, yeah, a huge, and there are people, honestly, flossing is just fine. But there are people who need that extra little bit because when you have like crowns, which is like caps that are over the tooth, I don't know if you know what that is, or bridges where it's two caps and then there's a fake tooth in between. There's a lot of area where stuff in the water flosser will just get it right out. So, but usually I don't like tell patients to get that unless they've been there. Well, unless they say they're flossing. I'm like, well, flossing is not working for you. So why don't we get a water pick? And then, today, which happens almost daily, like I'll have patients that are like, every hygienist I go to says I should get one. It's like, really? So why haven't you? Do you like to have continued infection going on in your mouth? Totally up to you. It's surely, your call. So.
I heard a statement a long time ago. It said it was 90% of the issues that come to the dentist are due to the people not flossing. Is that true? Do you think that was true a long time ago, or is it more true now, or not even true ever?
Both, I would say. Deep cleanings, all of the deeper. So when I measure the pocket between the tooth and the gum. All of the deeper pockets are always in between where they could have been flossing. So people are usually I have the occasional person who brushes every other day or so. But a majority of people do not floss. There's a lot of studies on that. However, yeah, I would say a majority of them have to do with that. Exactly. So yeah, decay. So not to be all technical and a nerd. So you have bacteria in your mouth. Everybody does. And every time you eat, you're feeding the bacteria. And every time they eat, they produce acid. And that's why they always say brush after you eat. So that acid can do one of two things if it's not handled. So it can break down the tooth itself and cause cavities, or it can, it can break down the gums and infect the gums, and then that's when it causes things like deep cleanings and bleeding gums and infected gums. And people often think, oh, my gums bleed a little bit, it's no big deal. Well, it kind of is. Like if you had a cut and it was constantly infected and it was not healing, you would go to the doctor and be like, hey, what's up with this? But people who it's kind of out of sight, out of mind in the mouth, but it's still infection nonetheless. And it's very much so related to the rest of the body. Like it has a huge effect on the same bacteria in the mouth. The same is found in heart disease, certain cancers, diabetes. It can cause low birth weight babies. Like it's pretty serious. Like this is part of your body. You need to take care of it. You need to be on it. You need to make sure there's no infection going on in there. And it's hard for me or any hygienist to convey that in 1 hour. there's certain things that we're trying to focus on, and it can be very difficult. And then some people, it may take 5 visits before it finally clicks, so.
If someone were to use some analogy and say, like, every time they go to the car mechanic, they always get all these upsells on doing something. And if they say every time they go to dentist, they feel like there's just so many.
Certain offices, yeah, absolutely, they do. Depends on the office, depends on the culture of that office. If they're going to an ethical office, like mine, I only work for ethical offices. The only way we would ever let them know that they need anything is because they actually do need it. If you have a severe infection going on and you're bordering on becoming a deep cleaning, I'll recommend that you get a laser treatment, and I'll tell you exactly why you need it. I am not there to pressure you. If you want to walk around with infection in your mouth, totally your call. And I will sit patients down and be like, well, how long do you really want to keep your teeth? The rest of your life? The next 10 years? You tell me, because then I can tell you what you need based on that, and I will be very upfront about that. So, because I do care very much about my patients' health. I mean, I've had patients that have come in, they haven't had their teeth cleaned in like 10 years, and they've come in and they are diabetics. And then we get their teeth completely like back on par, back on health, deep cleaning, everything. And I will know there's been a couple of patients, they've come back and they're like, my A1C levels dropped. Like, I've been working on my diet, my exercise, this, that, and the other. And then I come get my teeth cleaned and it's just boom. And I'm like, yeah, you've had constant infection going on. I
had a question.
Sorry.
No.
Am I mesmerizing you with my awesome teeth? Like,
no.
There's like my 2 favorite subjects, me and teeth. So.
Well, no, let's dive into the ethics. That was the thing. What do you define ethics, and where does it break down in dentistry, and why, and the whole thing of ethics in there? So.
Like being ethical as opposed to like, what does a non-ethical office do as opposed to an ethical one? So I have worked for non-ethical offices. There was a dentist that I worked for, and about 2 weeks in, I realized he only wanted to do crowns. He hated doing fillings and wouldn't do fillings. So a filling is grinding out decay and filling it with tooth colored restoration, so that there's no more decay. The decay stops and now your tooth is healthy again. He didn't like those. He only liked doing crowns because crowns are way more money. And so, yeah, if there was a person with a lot of different decay, he would point out the crowns, get that done, because nowadays it's a little bit more difficult for the unethical dentists to get away with, oh, you need a crown. Well, now insurance, they're like, we want an x-ray. We want a picture of that decay going on before, we say, yeah, you can do it. So with the crowns, it's kind of pretty obvious on an x-ray, if you need it done or not. So yeah, so that to me is completely unethical. You're going to let the rest of it stay, in that state until it becomes a crown now, no. Not going to do that. There are hygienists who will tell people that they need, a deep cleaning when really they don't. And I've had some patients, so my last office over the quarantine ended up getting merged in with another office, and all our patients and, staff. And so there were patients who were like, well, that's a little far for me, so I'm going to go to this, other office. And I've had, a couple of patients. One of them was like in tears. This last week, and she was just crying. She's just like, they told me I needed a deep cleaning. They told me I had all this infection. She's like, I know I don't have this. And I looked in her mouth and I'm like, no, you don't. Like, oh, man. Yeah. Or she would have been out like $1,000.
Yeah.
Had she like believed them and let them go through with it, which is really, really unfortunate. And I sincerely hope that doesn't happen that often. So Yeah.
Huh, a little
So
bit.
there's ethical and there's unethical, and there's in any profession though. It's
Yeah,
not
that's.
just in
I was just gonna
our
say every
yeah,
profession,
and
IT.
yeah.
In IT, if someone's fixing your computer, they could say, "Hey, you should do a virus scan," when they know it could be something else,
Yeah.
like a network card or maybe even a hard drive issue or something. So the IT people would know what's right and wrong, what's technically ethical in those
Mm-hmm.
situations. I would imagine car mechanics. That's an easy one to kind of
Yes, I
yeah.
think we've all yeah, being a woman, kind of yeah.
Yeah. Um,
So yeah, but it's not just professions, it's every demographic, there's always bad seeds everywhere, no matter where you go. There's greedy people. Yeah, it's unfortunate and I hate to see it, but it happens. So yeah.
do you happen to see? So this is kind of a big question. You may have to think of it holistically. Does insurance cause any bad practices? Meaning, I had a physical therapist. He was talking about how insurance. Um, he does more of a holistic take on the body
Mm-hmm.
and not just the thing that's hurting.
Mm-hmm.
Because the thing that's hurting might be something
The
else.
source can be
Yeah.
elsewhere. Yeah.
And insurance is trying to just fix that one thing, and insurance doesn't.
Because it's cheaper.
Yeah, exactly. So, do you happen to see anything like that in the dentistry area?
Yes. One of them is, gosh, laser treatments. I do laser treatments on my patients, and basically, there's different types of laser treatments. For the gums, when I go in and I get the tartar, so tartar is the kind of the commercial word for it. It's called calculus. But with the buildup, if the gum's infected and there's a ton of buildup out, and I get it all out, it doesn't help get rid of the bacteria inside the infected gum. So I'll go through with the laser light and kill the bacteria underneath the gum line. And it's amazing, like all the results that I've seen, but insurance won't cover it. They won't cover that at all. And that's the first thing that comes out of people's mouths. It's like, well, is insurance going to cover it? Unfortunately, no. And it's proven science. I mean, I've seen it on pretty much every time that it heals the mouth, but no, they refuse to, cover it. Or it's really unfortunate. And just, there's, people will sign up for insurance. And dental insurance is probably one of the more difficult ones to get if you don't have an employer that offers it. And so there's a lot of other insurances out there that you can get for personal reasons or for personal. And so the unfortunate thing about that is they'll get their dental insurance and they just come in, they're excited. They're like, let's do it. And then it comes to find out in the small print, we can't do anything to you for a full year until you've paid all of your, and so it's just like, are you kidding me?
Yeah.
And then generally, because my office, he's just amazing and they'll figure something out. There's other routes of, dealing with it. But a lot of people, they worry about, the basic necessities, food on the table, roof over your, your head, your kid's head before usually moms are always like the last ones to take care of themselves, like literally, because they take care of their entire family before they take care of themselves. And it's just, and they're ready to go. And it's just like, so yeah.
Is there anything kind of like analogy of stem cell surgery, like in the medical field? I see that doctors aren't really, it seems like they're not allowed to talk about stem cell surgery. Like if for my foot, I had a car accident like 6 years ago.
Mm-hmm.
I went to see a doc, like 4 or 5 different doctors, and 6 months later, the idea of stem cell surgery came up to me, and I didn't really know anything about it.
Mm-hmm.
And
I don't either.
So I guess it's just, I don't know enough about it. What my understanding of it, it's basically getting stem cells from somebody else that's healthy and injecting into that area, and it'll help heal that area or make it stronger.
Okay.
But the
kind of like leukemia and blood marrow transplant kind of thing, or
I don't know.
Go ahead.
So there's been, for I think 20 years globally, there's been a lot of positive things about stem cells, for whatever the reason, the insurance companies don't want to do it, because if you shoot in stem cells and it fixes the problem, then it won't break, so that they could get more people to pay for insurance. Like, so
I see what you mean.
So even as far as the doctors aren't supposed to mention it, I think. So it was odd, after like the sixth doctor, after the 6th month, I was like, hey, what do you think about stem cell surgeries? And she all of a sudden light up, yes, do it. I'm like, whoa, what?
Really?
Why didn't you guys why didn't anybody mention this before? And she was so happy that I brought it up. She said, go do it. I'm like, somebody should tell me 6 months ago.
I'm going to go research that now.
Yeah, so
it could be. It's kind of like, you hear about like, if there's a cure for cancer, it's such a huge money industry.
Yeah.
What's really gonna, is it really gonna be brought forth and used? So no, I get it, 100%.
Insurance.
Yeah.
Insurance or money or greed, whatever.
Yeah, and it's really, I could go on a whole tangent about that, like really, and it's just frustrating for me, because my end, I just use my knowledge and and to help this person.
Yeah.
And I'm not going to lie. There are times where I'm just like, you know what, we're going to call it this, and I'm just going to do this, and just, book me for that, not for everybody, but there are situations where it's just like, there's no way that they're going to get help, or, there are other outlets like the dental school, UNLV School of Dentistry. They have students that are working on, patients, and they do, I think, like a sliding scale depending on their pay, that sort of thing. There's different outlets, but sometimes, it's a need that's immediate. You've got, single moms, single dads, that are working their butts off. They have kids, it's like, I don't want them to go off into the world having all this going on. And, and a lot of it, and I don't for sure judge anybody that sits in my chair and like, I haven't been to the dentist in like 10, 15 years. All right, well, let's get to it. I'm not going to judge that. I'm glad they actually took that step to sit in my chair and be like, okay, then I'm just like, let's get you healthy then, and let's do this. So, because like I said before, a lot of times it's like, you're worried about food on the table, a roof over your head, that sort of thing. And then those teeth came last on the list. And I get that. But once you're educated and get it handled, you have no excuses. Then I just get pissed off. And I'm just like, you should have handled this. You knew better, so, but yeah.
I like doing these conversations a whole lot when talking to someone that's educated in their field.
Thank you. Do I seem educated?
Because you're taking for example, maybe if I would have asked that question about the 73-year-old, if you had, I imagine someone that might not be educated in the field, and they might just say, oh, let the person die.
No.
No, I'm just, yeah.
No, I know what you mean.
Yeah.
I get
because you even brought in a whole new idea that I don't think anybody except for in your field would think about, is that would know about, where that person's chewing, if their teeth are messed up, so they're probably chewing a different way, so they're having, that's less certain foods in their diet that's affecting their daily life in essence. So it's a holistic thing.
Puts a whole new perspective on that. 100%.
Yeah, the physical therapist that I talked to, that was really interesting in his approach of trying to be holistic. He even brought up mental illness. So then one of a talk I did a long time ago with Trin. She's the director of NAMI in Southern Nevada. So do you know NAMI? National Alliance of Mental Illness. So it was pretty cool. I actually, once I did the interview with him, I brought it up, and he's like, oh, give me their number. So he's going to try to hook up with the San Diego chapter.
So you have some great networking going on.
Potentially, we'll see. But I mean, it was great for him. He didn't know about NAMI, because a lot of times people are afraid of the money, and NAMI's a fully nonprofit, free for everybody. So
which is really good that you're even doing this series, because there are things that you never thought about. There would be things that I would never have thought about watching some of them. Your cannabis guy was pretty interesting.
The one?
Your
Which
cannabis guy?
one? Oh yeah. we did one. We did a second. That's actually.
I saw the second one because you guys were talking about. Okay, we were so stoned. It's like, where's that one? I want to check that one out.
I'll send you the link. It was actually, I think last night my cousin messaged me like, "Hey, can you send me the link to the first one?"
Yeah, because I saw the second and I was like, "Hey, that looks interesting."
The first one is actually. It's actually the same thing, but we're just so slower. We're too high.
When does the shrooms guy come? I want to know.
Shit. I don't have anyone with the shrooms. Actually, he that guy
It's not technically legal, I guess. So it's different with the cannabis, I guess. Or I don't know. I'm so
I want to say
clueless about a lot of that.
I want to say shrooms is legal. I think it's legal here in Nevada.
A lot of my patients self-medicate themselves. Yeah. I get that contact. Whew. Like, they come in like, did you self-medicate today? And they're like, oh, cool. Whatever makes this whole appointment, plus we do nitrous and all that too. So yeah, for sure. You've got, back to my point though, it's great that you're doing the series because you learn a lot about other professions that you didn't realize. So,
there's one with a psychologist, a social worker, but she kind of does very similar work to a psychologist. Social worker where she's helping veterans that deal with PTSD and I think now she's more focused on gambling and drinking addiction,
especially in this town.
Yeah, exactly.
100%. Yeah, I know. Yes.
So to talk to her, there's a lot of things that was really interesting. An odd one to me that I didn't expect to have. An interesting point was what she brought. We talked about how Facebook, Twitter, and YouTube seems like it's bad on the world. Like just as in people in their echo chambers, like Facebook, and like if you're into QAnon or far right, super far extreme right stuff, or left, either way.
Yeah.
But you get into an echo chamber you find groups in Facebook, and you're in an echo chamber. So then we're discussing that. She's remember MySpace? I'm like, yeah. She's from a psychological thing, MySpace was about me, but me and me to show all of you, except for now Facebook is like a popularity contest. I was like, holy shit, I didn't think about.
Same with Instagram.
Yeah, exactly. On Instagram, I hear that I saw a news article where people are renting private jets, but not to fly, to take a selfie in the private jet while it's still on the ground, just to say, yeah.
And what is that?
TikTok?
No, that's a whole other thing. No, there's this thing, and I had to ask a millennial what it meant, where it was, what was it? Where it was only fans. Is that what it was? I was like, what's only fans? And she's like, yeah, we're only, I don't know. And she explained it to me, and I was just like, it's kind of stupid, but it was just, I don't know. We're like women who they have their site blocked and you have to pay money to see their feed, and then they show themselves off kind of thing. But I remember after that, because there was a bunch of memes coming out about OnlyFans. I was like, what is that? I'm kind of happy that I didn't really know about that. But yeah, it really is interesting. You're absolutely right. It is a popularity contest. So, yeah.
On a tangent, the idea of this show for doing a 2 to 3 hour conversations, yes, it's very long, but one of the things I feel that people that know their craft can talk at lengths. Like if I get someone in here and they're talking 30 minutes, like it's too easy for them to throw out ideas from their field of work, but they don't really understand it. They haven't lived it. Like when I work in IT, I could tell stories of, well, yeah, a company told me to code this, but then I saw that it's not going to help the company. So then I went to the upper management and said, hey, we're wasting a lot of man hours on this module and we're not going to benefit. Let's focus on something else. So it's like being in those jobs for so long, you should be able to have that input, like you're saying with the 73-year-old eating. Like some people that don't take their job seriously or don't
have a passion for it.
Yeah. Yes. Don't think about those things. And I think those things I feel like that makes, like the physical therapist. Actually, it was so funny interviewing that physical therapist. I think I messaged him afterwards. I said, hey, thanks for that interview. I went into that interview thinking, oh, it's just going to be physical therapist. Like,
Wow.
I was like,
Wow.
So, but then like he opened my eyes on this whole holistic thing. Because I actually even asked him in the interview. I said, okay, let me be a devil's advocate, or let me play the devil's advocate in the sense of, if someone were to say, physical therapists just want me to visit them every week and get my money. So where do you come in and prove them wrong, or what are you doing that actually helps this person? And
I mean, he was passionate about his
yeah,
answer, wasn't he?
holy,
yeah,
heck
oh
yeah.
I bet
Yeah.
he was. I
Yeah.
understand where that comes from, because I get stuff like that too.
Yeah.
Like you just take X-rays, for money. Actually, no, we take X-rays to see what the heck's going on in your mouth, because we don't have X-ray vision. We don't know what's going on in there. So yeah, I know exactly where you're going with that. Yeah, and to have that passion, and you can even have somebody in that same field who has been in it for a million years and they've lost that passion for it, and you can tell that they wouldn't have much to talk about either. And so it's not always going to be about what kind of experience they have. It's about whether or not they love. I know dentists who hate being dentists. I know hygienists who hate being a hygienist. It's like, why are you doing this? Like, but
the last conversation I had was I thought real interesting. It was a friend. We were just gonna chit chat.
Yeah.
And then it went into like, I was really
in this forum, or just
in this. We did a 3-hour talk, but it was webcam, which same thing. But he went into I usually like ask people about their career, their path, so then I know that I think it's good enough for 3 hours. Like if I have a feeling that they're going to be able to talk about 45 minutes, I'm like, that's
yeah. No, I get that.
So he went in saying, I've been a waiter at a restaurant for 16 years. And I was like, okay.
No, I bet he's got great stories, huh?
He went into at the age of 29. He went back to college, and he's gonna go for his doctorate, and he thinks he's like 34 now.
Okay.
He may not be done until 40 years old with his doctorate, but it was awesome to talk about. So you were a waiter for 16 years, and then you all of a sudden you didn't want to do college, and then you went
flipped it.
Not only just get your bachelor's, you're going to your doctorate.
But good for him.
Oh, it was awesome.
Yeah. That he was like, nope, not for me anymore. Where so many people would just, stick with it, stick in it, and just, because sometimes for a lot of people that comfort zone is just that comfort zone. They don't want to get out of it. It's hard to get out of that comfort zone and do something different. Yeah. Completely hard. I love what I do, so I never thought about. Well, of course I've thought about it, but
did you feel you fell into it, or was it
like the reason I started?
Yeah, let's go all the way back. Let's go back to Yolie when she was 16, 14.
Yolie was 16, 14. She wasn't like every other 16, 14-year-old. I want to be a vet, I want to help animals. No, never thought about being a hygienist until mid-20s. And I'm going to admit that wasn't the most ethical reason. My dad's best friend, he was a hygienist. Very rare to see men in hygiene.
He was really hot?
No.
Oh, that's
my dad's best friend.
Okay, I thought you said something like this story isn't
nothing against you, Roger. You're a good looking guy. But you're my dad's age. No. Yeah, he's hot. No, it's not a reason I even know. No, but he was doing really well for himself. And I was just like,
oh, okay.
I want to talk to this guy. Didn't really know anything about it. So we're having some family function. I'm like, because I think I was in, what was I in at the time? I was in insurance and bonds. And
if you want more water.
Oh, I'm good. Okay. There'd be less if you actually put vodka in here, but it's all good. I give you.
I could actually. Do you want some?
Let's just how saucy do you want this conversation to go? Up to you. Anyway, what was I talking about? Oh, so we had a family function, and we sat down, and I just really wanted to drill him about his profession, and I actually considered being a dentist. Part of me sometimes wish I did, but then again, I really, like, if it was going to be all day, every day, I'm glad I'm doing what I'm doing. So I kind of, the idea struck me mostly because the pay was, because hygienists actually right out of school, you only really, to become a hygienist, you only really need an associate's degree. It can go all the way up to master's. I think, is there a doctorate? I don't know. But, and there's a lot of options for a hygienist, because I only have my associate's degree. You can get your bachelor's, but that's mostly if you wanted to get into education, work in the university setting, teaching, that sort of thing. No interest in that whatsoever. So I went ahead and that's when I got into it. So nowadays, though, if you go to college to become a hygienist, they require you to go into the setting and follow a hygienist around to see really what they do. Instead, for me, it just happened to be a very lucky straw that I drew, and I just ended up having so much passion for it and loving it so much.
What do you mean by the lucky straw? Like, for
picking a profession? I mean, that's such a hard decision to make when you're younger. Like, what am I going to do for the rest of my life?
Heck yeah.
It's like, and if you pick the wrong one, you put all this time and investment in the incorrect one. So, and it was, interestingly enough, because I am all about educating yourself. I am all for, I told you that I work for the UNLV School of Dental Medicine as well. So I'm all about educating. Like, I've worked with the students for dental hygiene from CSN, and I've also worked with upcoming dentists for the dental school. So I had one office, and I'm not going to say his name or the restaurant, but he was part owner of a very well-known restaurant in Vegas, very successful restaurant. And he was following me around for the particular class because you have to get in so many hours. And I'm like, wait, what? Like, what? There's no way you're not successful. He's like, actually, my brother and I have very different ideas about how the restaurant should go. And he bought me out. And now he's like, I researched every profession. And as far as, money back investment sort of thing, he's like, dental hygiene was the way to go. And I'm like, pretty much is. To me, it is. Because right out of school, they can make pretty decent money if you go from, So, that's how I got into it originally, was my dad's best friend. And, I want to say originally, it was like, ooh, he makes, pretty decent money. But yeah, and in the end, I just loved it. And back when I went to college, it was like about your grades, and that's how you got in. So all of us were a bunch of 4.0 women who were just anal about everything. But now they put in a bunch of different other factors, like whether or not you can use your hands for something small, because they were finding that a lot of people, you have the brains, but you don't have the dexterity to be doing this, and there's a lot of different.
That reminds me of when my ankle was broken, I had one X-ray that was to be done, MRI, and that doctor must have had
He was shaky?
Yeah, and he was injecting me with a big amount of liquid for the MRI, and it was hurting me. Like, he put it in the ankle, and it's like,
you're just killing the tissue.
Yeah. I was like just laying there like,
You're so polite.
He was so old, because I felt like if I said something, I don't know if he would. I don't know.
This guy needs his job, so I'm going to take him. Hey, such a good guy, Liem. You're a trooper, really.
Why did I get into that? You talked about did you say X-rays or no? Oh, people with the dexterity to do their job.
Yeah. And it's
for dentistry is like okay, I got into computers and IT because that's something like I could play with video games, and then I got into doing websites, and then I was like, it's a natural progression to get into IT. Now, dentistry, where did you run into that? Did you just literally pick a straw out of a hat? Or actually, no, you had that one person that you were interested, that they seem to be doing well in money. But what's the progression there? You just picked it and then you ended up liking it. But is there someone that's interested in the field? Can they test if they would like it somehow?
Not really.
Yeah.
Because you can't do it unless you're graduated, licensed, for it.
Yeah.
And then at that point, it's too late. But you can probably get an idea in the middle of school, but you've already invested so much time and money.
That's actually, okay, so is there a way, where would you say, I think that might be a fantastic point. Is there a way in the middle, is there a way they could take certain classes before enrolling in the full?
You know what? Not even...
Is there
because your first patient because it's it's associate's degree, it's a 2-year program, very difficult. It's like boot camp. You really can't have a job. You're like 24/7 teeth, and yeah, and so you really got to end up liking teeth. But you can't. My first patient didn't come until my second semester of my first year, and so that's a long time to go and be like, and it's a very, at that point, not being used to, so people who are dental assistants before, which they can get trained on the job, are used to getting in people's mouths. But somebody who's not, if I told you to take 2 instruments that are really tiny and be like, get this out of my mouth, you'd be like, ooh,
Yeah.
And that's kind of the feeling that you have and that you get. So you'd have to be invested for quite a while. You have to get all your prerequisites done, and then getting into the program isn't that easy either. They want the cream of the crop to get in there because there's only so many spots for it. They only graduate. There's only 2 years in there. So you've got your juniors and your seniors. That's it. And it's very competitive to even get into it. And you can't be like a C average student and become a dental hygienist. I mean, your dental hygienists are always usually 99% of the time very educated women or men. Not to be sexist, but it's hard to get in there. And then once you're in there, you went through so much to get there. You don't want to, just drop it, and they're not, like I said, they want the cream of the crop. If you get below, I think their grading criteria is 95 to 100 is an A, and then 85 to 95 is a B.
Wow.
So if you have 90%, which in any other grading system would be an A, that's a B. So 85 below, if you get below 80%, so if you get below a B, after a while, if you don't get it back up, you only get a certain amount of time, you're kicked out of the program. So because there's so much knowledge that we have to know. We have to know how to, detect x-ray or detect decay on an x-ray. We have to know pharmacology because patients, again, the mouth is attached to the body, so we have to know the pharmacology. If you're on blood thinners, if you're taking certain things, it's going to affect what's going on. We have to know what's going on, the anatomy of the body. If you come walking in and you have all these heart conditions, I can't just come do your cleaning because I'm introducing bacteria into your bloodstream. That can cause issues. People can die if they're not, if your hygienist, dentist doesn't look at you. We ask a healthy people. Oh, this is one of the things that drives me nuts. People complain they have to fill out a health history. Well, this is just my teeth. Your teeth are attached to your body. We need to know your health. And it gets very frustrating because they will give the front office all kinds of crap. I just filled that out. You could have had a surgery in the last 6 months. You could have had all kinds of things happen to where now it's dangerous. I've had patients. I have one guy who fell and broke his shoulder over quarantine. Poor guy. His first time he actually got on a bike, broke his shoulder and had all these pins in it. We ended up having to give him a pre-medication of antibiotics because I'm introducing bacteria into the bloodstream. So where was I going with this? I don't even remember.
I don't remember either. But it was a good story.
Right? Anyway, but yeah, it's all related. Oh, school. So, so we need to know pharmacology. We need to know radiology, head and neck anatomy. We're injecting, because people can get into anaphylactic shock from the injections or the materials that we use to inject them with. Everybody calls it Novocaine, but there's different types, different strains. And different reactions to it. It's a very scary thing when somebody just passes out, on you, or they have any kind of reaction. So you have to be smart to do it. It's not just somebody who can just go in and scrape stuff off teeth. And even though people may think that my job is just scraping teeth, yes and no. I mean, it has a lot to do with, your entire body health. And so you have to be pretty smart.
Yeah.
So, yeah. Yes, I'm smart.
I don't know. I'm just thinking randomly connected to IT. The amount of stuff in IT as how much you have to know, even as a developer. There's so many. You could be a database admin, a network admin, an apps
So
assist.
different
Yeah, but there's
levels
so much to
of.
know. And then even as a developer, I try to learn a little bit of sysadmin. I try to learn a little bit of database administration, just in case, because as you work on it, you're going to touch that stuff. So I'm imagining just the amount of stuff that you can learn, because there's probably, you just gotta, some people just want to get through school. There's some people that probably actually, they want to excel in their
field.
Yeah, and they tend, those type of people tend to do additional research or try to pick up as much knowledge on their way.
100%.
Yeah.
Which is so for and I do like, if there's anything new out there, which there always is, science is always coming forward. I talk about lasers, but how long has that been out? 15 years. Like, just because your office is old that you went to and never came out with it doesn't mean it is a better way of doing things. Kind of like, I don't know if you've ever heard of how amalgam metal restorations, how people, they found that it's just not the thing. So when you take out a filling, a lot of times they'll put a metal restoration. Back in the day, now it's just unheard of that they use it. They use tooth colored fillings instead of the metal fillings, because the metal fillings, a lot of times you get more incidents where it can break down and get decay. Or in my case, like as kids, we got these huge fillings and then the tooth would break against the metal. Like, it's just a better, because science, research, everything, you've realized, things are now better. And so I prefer to be on that cutting edge, because I don't want a patient to come in and ask me, well, what do you think about this? Don't know, I never heard of it. I don't want to be that person. Also, I want to know how to best treat my patients as well. So yeah.
Is there anything you regret the path that you went to get here? Like, is there things you would have done? You think now what you could have done better? As in, like for me,
life choices. You mean, or
for
career choice?
the career in I'm trying to remember the word that you do. The word of your job. Hygienist. So the path.
What do you do, Yolie? Wow, no.
for a hygienist, the path that you went, do you have any regrets that where you would have made it better? Just looking back now, like for me, I think it's a bit unethical, but I would have.
Let me preface this. It might be a bit unethical.
I would have. I would have embellished my resume more, because I'm able to talk about my craft and my skills, but my resume doesn't seem to speak that.
It doesn't reflect that about you. That's not unethical, because I think
to me,
wait, let me talk. Yeah.
Yes.
Not to be a woman, but I think that you are motivated enough that there was something you didn't really know about, you would catch on really quick and figure it out. So that embellishment would have been more to your benefit and your employer's benefit, because you would have been the best man for that job. And I don't mean, well, I guess we got to figure out what kind of embellishment you were talking about first. But I'm sure the position that you were looking for, you would have been able to handle just fine.
All the jobs I have, I've been able to handle
then there you
perfectly
go.
fine. So that's where I wish I would have kind of
fluffed it up a little more.
Yeah. So it gets that could be a gray area. So that's where I usually like to be a little bit. I like to be more cautious in those situations. I'm more risky in other situations, but that one I'm more cautious about. But that's looking back, I wish I would have embellished more on my resume.
So I don't mean to toot my own horn, I guess, but I have always been such a go-getter. I don't think, aside from coming right out of school, there has been a job that I haven't been offered that job, because I don't know. In school, I was the president of my class. When I came out, like whatever situation there was, I wanted to be the best at it. Not the best competitive wise, like dump all my, I'm just, I want the best for my patient. I want to represent myself the best way I can. So you know, if there's a competition, I'm all in, you know. So yeah, no, I mean, the only thing is my choices in jobs, but for me, I'm a huge believer in everything happens for a reason. And where I'm at now, I couldn't be happier. And had I not taken that path, that zigzag path that I had taken, I wouldn't be where I'm at now.
Yeah.
So,
Yep.
you know, and I
totally
am
see that.
beyond happy to be where I'm at now, you know, with the dentist. That is amazing. There is zero drama in my office. It's just, I have great people I work with. I don't mean to say this, but a lot of hygienists are very type A, you know, people. The hygienists I work with are all stages of me in growth. I'm actually the baby doing it 20 years. You're looking at 25, 30, 40 years, but they're all so cool. It's like I'm saying I'm cool, but I am cool and they're cool too. So, I mean, I couldn't be happier where I'm at. So
on your statement of if you were to change it, your path would change and therefore you wouldn't be who you are today. For me, I think about when I got my degree in 2009, but I took a pause from 2001 to 2009. So I could have had my degree in 2003 probably, but I waited till 2009 to get my bachelor's degree. And
do you regret that?
I do regret it, but
same. But go ahead.
But I think the path that it led me down, I got to see a lot of things, and that the way I reflect on life, the way I think about economics, politics, the things I see at work, the corporate politics, it's all because of the path that I took. And
and it makes you appreciate things differently.
Yeah, exactly. I think if I would have got out of college at 2003. Maybe I would have stayed a cocky son of a bitch. Like
What? You're not one now? Okay. I'm just kidding.
I think that maybe having the degree, I probably wouldn't have gone to programming the way that I did. That was a total fluke. I jumped into
everything happens for a reason. Yeah. I'm a firm believer of that.
Yeah.
I think the people that come into your life, your mentors, your jerks, what have you, everything has a teaching element to it. And I feel, you're where you're at for a reason. Yeah. So, agreed. Very much agreed.
If I look at the phone, I'm just going to try to look for preloaded
Whatever,
questions.
you can check up on your Twitter account.
I'm the millennial that needs to be on the phone all the time.
Tweeting, this interview sucks so bad. No,
I hate dentists.
Never going to the dentist. Don't go to Youlanda.
Why should people make oral health a priority? I think we've already...
Total body health, 100%. A lot of people, they come in, majority of patients, unfortunately, it's about aesthetics. Your gums are falling apart. Your breath is awful. Like, I have women who are just dressed to the nines, just gorgeous, beautiful face, beautiful hair. They paid all the money for, their products, their, lip enhancements, whatever enhancements, and they open their mouth. It's just like, I don't even want to know what your bathroom looks like because no, I haven't picked up a toothbrush. So yeah. And unfortunately, and they're coming in, they're like, I want veneers. And it's just like, how about we keep your teeth first and go from there? Like, yeah. So unfortunately, aesthetics are just a huge part of dentistry. And there are dentists out there and they advertise cosmetic dentistry because, that's what people want. So, yeah. And it should be about their health, really. And that's really, what I feel my profession is about. Your total body health has to do with the mouth. The eyes are the window of the soul. Your mouth is the window to the rest of your body. What you eat, how you take care of your mouth. Yeah, it's huge.
I was thinking kind of a tangent way back to an earlier topic, the ethics. How can a patient think about the ethics of a dentist, or how can they know the ethics of a certain dentist?
So when you walk in, though, so I get this a lot with patients and that end up coming to us and a lot of them they were like, I just got this vibe. I didn't feel good. I didn't feel right. Go with your gut. and what you think. There is nothing wrong. I've never met a dentist. I've never worked for a dentist who won't do a second opinion. Because they'll print out what's called a treatment plan as far as what's listed of all the treatment, how much it is, what have you. Take it to another dentist and be like, well, what do you think? And like with my dentist, he'll either agree or he'll, he's a very professional guy. He's never going to bash the first guy. Kind of think you only need a couple fillings. You don't need all those crowns and stuff. That's the only thing I can say. There's no red flags on these guys' offices. There's, but when you walk in and you feel super uncomfortable, or they don't seem genuine, or they're fast talking and it feels like you're being sold something, which is a fine line for us, because I have to tell you why you need things done, and it's for your health. And I'm hoping to convey it in a genuine way, because I really do care about your health. Whereas if they come in and they're just like, oh, you need this, or you're going to lose your teeth. Yeah. So, yeah. So I would just say, there's no warning flags, but trust your gut. Get a second opinion. And if you realize that the people originally that you went to, like, you liked them, but you weren't sure, get a second opinion. If they agreed and you're like, oh, they were right, then go where you're comfortable. Don't just go. You're gonna get what you pay for too. So there are dentists that are like, oh, I'll do your crowns, $30. They're gonna fall out in the next year probably. But so yeah, there's always that, because some dentists are about volume. Some dentists are, they'll charge an arm and a leg for something, and it's a difficult thing to go in and find somebody who's a true artist at what they do and have a good bedside manner. You might have one or the other. You might have a great bedside manner. I've worked for dentists. They're like, I love him so much. Well, yeah, he's the sweetest guy on the planet, but he doesn't know dentistry for shit, And then there's the opposite. There are dentists who are just jerks, but man, their work is beautiful, because they have a talent for what they're doing. So it's hard to find that, both, which is one of the dream, where I'm at now is a dream job, because I have both in my dentist that I work for. So, yeah.
I had two family members go to one dentist in, I won't mention the area in case I don't want to give a bad rap, because I don't know. Anyways, both my family members went there and they're like, man, this dentist guy does everything for cheap, and he seems really cool. Man, the prices are amazing. And both family members kept on mentioning the price, and I'm like,
Seems awfully cheap.
Yeah, that's interesting.
Yeah.
I had no idea about the ethics of it.
Yeah. I remember when I had an aunt. She was my great aunt, and the dentist was like, "Oh, you need crowns on these two front teeth." So he put crowns in, and they're bright white. Natural teeth are not bright white. People, I feel, sometimes want that picket fence look. You ever see that show in Friends, or where Ross over whitened his teeth?
Oh, I didn't see that episode.
It's not natural to have like bright white teeth. It really isn't. Normal teeth have a very, they have a little bit of a tint to them. But yeah, this dentist, he made her crowns bright white. Well, they didn't match the rest of her teeth. And he's like, oh, well, we're going to have to get you teeth whitening. She's in her 60s. All she wanted was functioning teeth. She didn't care about, and so to me, completely unethical.
Ageism. No, just fucking.
Whatever. Whatever, Len.
How difficult was it to become a dental hygienist? I think you already kind of talked about that.
It's hard. Yeah, it's hard. I didn't even get in my first year. I had a 4.0. It was a lottery because everybody had 4.0s, and there was only 30 chairs. And so there was like 45 people, and so it was the lotto. And so I got in the very next year. So
what's that? Do you have to repay? So that first year that you missed the lotto, do you have to, when you take it again the next year? How's that? Do you pay again?
That was 20 years ago, Liem. I don't know. I don't think so. Actually, no, I take it back, because I was in England, and I remember my mom opened my mail, and I was just like, oh, because you just want to get in, you want to get it over with. And then right when I got back, I got another letter that said, you're accepted for the very next class. And I'm like, oh, okay. Well, then I got a year to breathe, so yeah.
Huh.
Yeah. I don't recall paying. No, I wouldn't have had to pay because they just immediately accepted me for the next year. So.
With that lotto system, so say you said it was it 50 and then 15 got accepted, or what was the numbers?
Oh, there was 30 seats.
30 seats.
Yeah, because there's
Out of
only
how many people?
in our particular clinic, because there's other programs in Nevada. There's two. There's one in Reno, and there's one here. One is Truckee Meadows, and that's a community college as well. And then there's CSN. And there's only so many seats for you to be able to get into. There are other states, and I've seen people leave the state to go to be a hygienist. I think there's private schools. You have to pay a lot more, but you can go out of state, go to a private school, and get your degree. But yeah, there's only 30 seats because in the clinic itself, there's only 15 chairs. I think Truckee Meadows has less. I don't know. It's been quite a few years since I've been up there. But you only have 15 chairs. So you have 2 classes of actual clinic where you have a patient and it's just room, and having a dental chair is very expensive. So yeah.
Well, what happens to the people that don't get chosen? Or I mean, you don't know because you're not.
SOL, I don't know. If they don't get chosen, they just try again the next year. So it's quite a thing. It's a big deal. And then once you're in, it's not like it's easy because, like I said, you have to have 85% or higher, to stay in, because you can just very easily just get kicked out. So yeah, it was pretty tough. It was, like I said, it was like boot camp. And I know I didn't get in that first year, but the second year, the people that I went to college with, I have lifelong friendships from that. And like I said, everything happens for a reason. And just I couldn't be happier how it ended up. So, yeah.
When should a parent start bringing their child into the dentist?
So American Academy of Pediatrics. So I've also worked for a pediatric dentist. She's one of the most amazing ones I've ever worked with. Talking about mental health, when we were talking about that issue earlier, Mondays she reserved for any child that had any type of mental health issue, whether it's autism, or like say kids with Down syndrome, anything like that. It was Mondays only, and she was just amazing. But the American Academy of Pediatric Dental Health, I think is what it is. They recommend it 1 year. Or when that either for 1-year-old or when that first tooth pops in. So yeah, if you ask a regular dentist, they'll be like 4 or 5 years old because that's when we can handle them in our chair. But a pediatric dentist, I've seen actually a newborn with teeth coming in, which was really interesting. But it just runs the gamut when it comes to children. And she knew her stuff, like really on it. Just amazing. And I remember the only reason I had to leave is because my back can only take so much, because you've got a wiggling like 2-year-old and you're just like, I can only do it so long.
What would be the reason for getting a newborn, or not a newborn, but like a 1-year-old or 2-year-old in there?
Because there's also different other things that can go on in the mouth. You can get issues like if they have there's baby bottle tooth decay, if the parents and it's just and there's no judgment whatsoever, but sometimes parents just don't know. You can't really let your baby go to bed with a bottle because milk has sugar in it, and then you can start getting decay. And to enforce or educate more like it. And not only that, with little ones, you want to make their first visit to the dentist a happy one, not a traumatic one. If you wait till that kid's 3-4 years old and they have all this decay, and then guess what? They have to go under, they're going to go through this pain, and they're not going to like the dentist. There's a traumatic experience that I see as an adult happening there. But yeah, it's more for education purposes, I think, because a lot of people just don't know, or to handle teething, because it's painful for these guys to have, you've got a tooth cutting through your gums. It hurts. Tell them how to handle that, about nutrition, how to take care of the teeth, because they're really supposed to be brushing their baby's teeth. The second you see a tooth, you should be cleaning it every night because they're eating foods, Yeah. You need to keep it clean. So yeah.
What are the various positions in the dental office?
The dental assistant, the front office who deals with insurance and the finances, dental hygienist and the dentist. Sometimes you'll have a sterilization tech if it's a larger office. And what they do is they just kind of run the instruments and sterilization and what have you. So yeah, those are the general positions.
Is the sterilization job
Very mundane?
Or is it hard to get into? And or is it pay well?
No.
Oh, okay.
None of the above. It's not hard to get into, and it does not pay well.
Yeah.
It's very mundane. You're sterilizing instruments, although there are very strict codes. Like you'll be trained, really trained, but we have very strict criteria about sterilizing all of our instruments. Our infection control protocol in the back, what have you. So yeah, it's a really big deal. Like going into, just into the profession at all, one thing you have to know is that you're going to be exposed to everything. People lie. They don't tell you they have HIV. They don't tell you they've got, all these diseases, hepatitis, they won't tell you. They, whether it's embarrassment or sometimes they just don't know. You can have hep C and have no clue. But you're always trained as either with a dentist assistant or a hygienist. You treat everybody as if they have something, period. And if you're following the correct protocol, you're not going to catch it. So,
what's your thoughts on? So I have this theory that Americans tend to view viruses, viruses very negatively in general. Like meaning, I had, this is a little bit of a long story, I'll get to the point. I had a benign cyst here on my forehead about 7 years ago. And I didn't want to show anybody. I just felt like somebody would judge me and be like, I don't know, it was stupid. But then I was able to reflect on that and wonder why did I feel that I couldn't show anyone? Even Emmett, who I've known, he's my cousin, and like we are super close.
Your cousin's with Emmett? I didn't know that.
Oh, really? So like even him at one point, he was like, "Hey, can I see it?" And at that time, I was growing my hair out, and it was
just to cover it.
Yeah,
gotcha.
And I was like, "No, I don't want to show you. There's something just I didn't want to show anybody. It was stupid." I reflect back and think it seems like a friend that I had in college. This is another story, but I'll connect it. So I had a friend. He at one point, forget how it came up. We were talking about viruses and stuff, and he was like, "Don't tell me if anybody has viruses around me. I don't want to hear you. If you guys have anything, hepatitis, HIV, I don't want to hear it."
Yeah.
I get very freaked out. And when I thought about that, I kind of felt that was his is an extreme case, but I do feel that I see that in a lot in America, meaning because I've gone to Vietnam, even more tangent of this story. When I go to Vietnam, I feel that people are more accepting. If you say you got something, they're just like, oh, that's normal. Yeah. But here, I feel like when I see other people say that they got something, there's a quick negative
judgment.
Yeah.
Depends. Yeah, I guess it depends on the person. I mean, I see it so much that I don't.
Bad eye.
No, I don't. I don't at all, because this is a human being first and foremost, period. Whoever they were in the past and however they got it, may have been an accident, may have not, it doesn't matter. They didn't choose to have it. And so, no, there's no way I'm going to treat them any different. No way.
In your profession,
doesn't mean all hygienists are the same. What we were talking about earlier, there's negative in every.
Yeah.
So.
Do you happen to see that? Well, because I guess when you said if a patient comes in, whether they have hepatitis or HIV or whatever that they have, and they might not mention it, do you see a different angle on all that in the sense of that what I just said about? So I don't even know what I'm asking. I'm just bringing up concepts with.
Can I tell they have it by looking in the mouth?
No. Like as in, do you see other people perceiving them? Say the front office person, and they're seeing the paperwork. They're like,
"Oh, I've seen that." Yeah, unfortunately, yeah.
And do you feel that your reaction is different than theirs, or
100%? It's like, and I just want to let you know. Okay, I would have read that anyway because I look at my patient's health history. What's the problem? And then after that, it's never an issue again. Because I feel too, you kind of have to set an example. Like,
that's beautiful.
Shouldn't be an issue.
Yeah.
These are people. And then after they're long-time patients, they don't see that either. It's like they're people.
Yeah. Yeah.
You shouldn't. Yeah.
Yeah.
There
I
should
feel
be
like
no stigma to, no. It is actually illegal to double glove because, the patient has some sort of virus or disease or what have you. It's illegal to do that. You are not to treat them any different than any other patient. The protocol that we have set is for all of these diseases, infectious diseases, whether it's bacterial, viral, any of them.
I'm smirking because there's someone did a double condom test and it was actually worse. It is actually
worse. If you try to double glove, like you can't. You have your fingers are like have no circulation whatsoever. Yeah, no. No. It's just double condom. What? We're about to change this interview right now to something way more interesting. So go for it, Liem. All you. No.
I wonder where, back on that topic, and I really have no point. I don't know where I'm going with it. Why America has that. Maybe we're just so fortunate. Maybe because America, we're a first world country. We have a lot of hospitals.
Yeah, privileged, very privileged.
Yeah, very privileged, and everything everything. So that when I see in other countries, it's just. When I was in Vietnam and hearing people say, "Oh, I got this and that," and another person like, "Oh, yeah, that's fine." If I heard that statement in America, someone say, "Hey, I got this disease, I got this in my blood," people would freak out.
Mm-hmm. And they'd be like,
"Yeah, put on 2 gloves."
Yeah.
Huh.
Yeah. Nope. You're right. Unfortunately, you are absolutely correct. And then now we have this wonderful thing called the internet where people, look up, and you can have anybody come up with a fact sheet in their house that has no evidence behind it whatsoever. But the whole world's going to believe it because it looks official, and it's just really unfortunate.
Yeah.
So, but fortunately, they're people too, If I were to meet them on the street and not have a clue, like, even when I do have a clue, I'm going to treat them both the same, or whatever situation it is. So,
yeah.
Absolutely.
What's the grossest thing you've seen?
The grossest. My least favorite thing are people who wear it's not people who wear dentures in general or partials. Do you know what a partial is? Where it's only a couple teeth that they have a thing that comes out and it kind of fills the space for the teeth. Or there's dentures where they never take them out, and the first time they take them out is when they want me to clean them, and there's just all this food and for the past 6 months, and I'm just like,
why would they not?
It's a thing. So then I sit down, I'm like, okay, let's talk about
I would imagine
cleanliness, and
I would imagine the smell you could from 5 feet away probably.
There's a lot of smells in dentistry, so many. And unfortunately, I have a very extremely sensitive nose. So, yeah. And I don't want to be unprofessional and say it's gross, but I can see blood. I can see pus coming out, all kinds of things in the mouth. It doesn't bother me because I look at it clinically and I'm like, okay, how are we going to fix this infection? How are we going to handle it? How are we going to, But when I see like food kicked up that's been sitting there for days, then it's just like, that's the only thing. And boogers. I can't handle seeing boogers in people's noses because they're leaning back and then I can turn around. Mostly little kids with that though. Then I'm like, come here. Yeah, weird. Like I've had nurses come in and be like, oh, I can never do your job. And I'm like, you deal with the butt and the nose and penises and no. So I can never do your job. So yeah.
Do you see many difficult patients? I think we talked a bit about that. Is there anything you want to add on?
About 10%. No. I think we've covered
Can you
that.
tell if someone is a tobacco user by looking into their mouth?
Generally, it's more the smell first. Some hide it really well, and then I'll catch that one little whiff, and I'll be like, "Are you a smoker?" But as far as evidence in the mouth, sometimes yes, sometimes no. The heat. So my first job, I was kind of trained to recognize that. I shouldn't say my first job. So when I first started with UNLV School of Dental Medicine, we had a grant program where we took a mobile dental clinic, and we went to all the various high schools all throughout Nevada, and we would do tobacco cessation education, and we would also look in their mouths for oral cancer. Definitely for chewing tobacco, because the mouth, it's kind of like if you write a lot or you lift weights and you start getting calluses, that's your skin's reaction to that that attack of what's going on. So to protect itself, it's going to build itself up. Same thing happens in the mouth when you use chewing tobacco. Your skin is going to protect itself, and it builds up like a white. It's kind of like almost callus-like, but it's kind of like it's hard to explain what it looks like. But it's like corrugated white area, and it's like I can look in a patient's mouth, and it's like, you chew tobacco, you need to, I mean, even if their mouth's completely clean, they don't smell like smoke, then it's just like, well, you chew tobacco, you always put it right here. You need to quit, because number one, cause of oral cancer, or, quit, back off. It's not, you can't just tell somebody to quit any kind of, but this is what can happen. I need to educate you. This is, what's going to happen or could happen, or you need to move it around your mouth, because that your body's already reacting to it in a bad way. With smoking cigarettes, it's kind of like, somebody who's a lifelong smoker, they tend to look older right away because of the heat and the chemicals in the smoke. Same with the mouth. You can tell areas where the mouth is just reacting to the heat and chemicals. And so there's changes that go on. And those kind of changes is what you would consider precancerous, because those cells are already changing and modifying to defend itself against the attack of what's unnatural to it. So yeah, sometimes I can tell. Sometimes it's tobacco stain. I can definitely tell the coffee drinkers, the heavy coffee drinkers, bless them, because everybody, talk about an addiction that, you can't make it, Yeah, I would never tell anybody to stop drinking coffee or red wine. Go for red wine, 100%. I'll just clean it off for you. I get you 100%. You're my people.
Actually,
No.
so on the wine thing, what have you seen someone that just drinks a lot of wine, and then do you see it on their teeth by any chance?
Sometimes. It depends. Everybody has a different chemical makeup. Some people have teeth that absorb every stain. So if you're talking marinara sauce, red wine, coffee, tea, Coke, that can stain the teeth. And there are people where their genetic makeup, their chemical makeup, everything, their teeth just reject it, and they're just beautiful, and no stain stays. So it's luck of the draw with that kind of. So sometimes yes, sometimes no.
Okay, so probably in general, like coffee will stain a lot. So if someone
can't, not always, but it can stain a lot. Yeah.
So if
depends on the person.
If someone's proactive about brushing a lot, I'm kind of thinking about.
It doesn't always kill the stain. It's unfortunate. People who will brush right after they drink coffee, I have patients, bless their hearts, they'll even come in more often than every 6 months just to get rid of the coffee stain. I get it. So it's just, there's not really anything you can do. I've heard things about drinking through a straw. Nah, it's going to stay.
Someone said that to me, and I don't believe that drinking through the straw really.
That's awful. But just enjoy your drink. Yeah.
I've actually just recently, I'm quitting caffeine just like a few days ago.
Really? Is that why you're so cranky today? I'm totally kidding. No. I have the opposite effect. I drink caffeine. I am up all night. If I have it after like noon, I'm up all night. If I have an iced tea, I'm up all night. So yeah. I would be a terrible candidate for any kind of drug, because I would just like to the nth degree, like have a reaction. So good for you though. Because caffeine, from what I see and from what I understand, it's not an easy thing to give up.
No, so. I get, if you give me like a half cup of coffee today at say 9 a.m., tomorrow if I don't have a half cup of coffee by 9:30, I will get a headache.
Really?
Have
you been feeling lately? But that's your body withdrawal.
Yeah.
That's what it is.
Yeah, the first two, because I actually started weaning myself off, where I was doing less and less. Good.
Yeah,
and then
instead of like cold turkey.
Yeah.
That's actually better.
I went all the way down to like a quarter cup, and then
you're savoring every little bit.
I
It's
knew
my
it.
quarter cup of the morning. No, yeah.
I mean, I still will indulge. Sorry, I think it was a week. Has it already been a week? Because my wife then wanted to have some caffeine the other day, and I was like, I'll have a little bit, but I knew I was going to get a headache the next day.
Mm-hmm.
I just went with
You
it.
know your consequences.
Yeah,
so,
yeah.
Yeah.
So
I get it.
what was the
So you're talking
caffeine
about
thing?
stain. So if you drink a lot of coffee,
So I was noticing my teeth getting kind of yellow. So I wanted to. So I started doing whitening strips, and then I stopped the coffee, and then stopped Coca-Cola.
mm-hmm.
Yeah, it's not fun.
I would imagine not. It's like somebody telling me not to drink wine, but I'm in the industry, so.
Oh yeah. So then my next question.
You can whiten, actually, and not just the whitening strips. There's, in a dental office, they'll have higher percentages of bleaches that you can use, but you run the risk of getting sensitive teeth too. So,
is there any other foods that's not commonly known to stain at all, or anything? Any tips in the staining cosmetic side, because that's what
get
most
your
people
teeth
care
clean.
about?
There really isn't a whole lot. I mean, if you're just prone to getting stained, you're gonna get it no matter what you do. If you can abstain from all of those things, then yeah, that's gonna help. But then it's like, do you want your cup of coffee? Do you want your wine?
Yeah.
Like, yeah, of course.
Yeah.
You know, life's too short to not indulge and do your thing. You know, you gotta be happy. So a little bit of stain isn't gonna kill anybody. Your friends will still be your friends. Otherwise, they're not real friends.
Or they're just Instagrammers.
My Twitter people. I don't even have Twitter.
Gosh, I think Instagram yesterday. I'm trying, because with this platform, I probably
you need to go through all the.
I'm like clicking on Instagram, and somebody I'm clicking. I feel like a fucking boomer. Like I'm clicking shit, and it's like reposting something. I'm like, no, I didn't want to repost that. What the fuck just happened? Like, no.
Yeah, I'm pretty clueless about it too. Like, yeah, it's terrible.
What do you feel? What do you feel about fluoride is important, since it's such a controversial subject? I actually didn't know this was a controversial subject.
Really? Yeah, it's a huge.
Okay, so walk me through why it's a controversial subject.
So, did you know that we put fluoride in our water?
Yep.
So,
but it's a very small, like it's like I forget the number. It's like 0.003 or something.
Mm-hmm. People trip out about that.
Okay. Okay, so that's the controversy. It's not that.
No, people just in general, they're just very anti-fluoride. I remember listening to some talk show host calling us sheep for what we've been taught about it. Fluoride is a natural occurring mineral. And in some water sources, it naturally occurs in higher amounts. Like people who live in Colorado, for instance, a lot of their natural water that occurs there, that's in their tap water, naturally has fluoride in it. And yeah, there's a huge amount of controversy. I remember working at the pediatric office, and there were parents that were so anti-fluoride. And fluoride is a mineral that it strengthens your teeth. Basically, it strengthens the enamel against decay. And these kids, it's like, okay, so you didn't believe in fluoride. Now your child is going under surgery, which is that's a life risk. Any kind of surgery is a life risk because their teeth are bombed out with cavities. And there was a lot of controversy saying, oh, it's a poison. Da, da, da. Anything at a huge amount. If you get because you have vitamins, there's water soluble and then oil soluble. And it's just like, if you have too much of one, it can cause adverse effects. Same with this particular mineral. There's certain metals in your body. Like if you have too much of quantity, it's going to cause adverse effects. Same with fluoride. If you have, 20 times more than you should, yeah, it's going to cause adverse effects. At a certain level, yeah, it could be a poison. At 1 part per million, no, it's not. It's serving a purpose. Another program that I worked with, it's called Miles for Smiles. And it came out 2001. And when it was a mobile dental clinic that went to Title I schools. So children that were in a lower economy kind of areas. And the idea was to hit like 12 different schools in a year and give free dental services like, cavities, educate them on brushing, because kids from lower economic status, again, those parents are worried about roof over the head, food on, mouth. They're not caring about teeth. And it's an unfortunate thing how food you know, it's cheaper to get your kids chips and soda than it is to get, you know, fruits, vegetables, you know, that sort of thing. So they showed up in the first school, and in that first school, you know, never mind the 11 other schools they planned to do in 1 year. That first school, they spent 3 years in that first school because there was so much decay, and a child can't learn with decay going on in their mouths. So I think that kind of helps stem towards putting fluoride in the water, because these kids don't drink bottled water. They don't drink, you know, the parents don't have, you know, what do you call it? The filtration systems.
RO, like water.
They all drink tap water. So, and then, you know, they drink from the, you know, water fountains at school in those demographics. And so adding it to the water was like the most sensible thing to do, because that's what they drink. And people were in this huge uproar. But if they would sit and educate themselves, your basic filtration, whether it's a brittle water filtration, takes the fluoride out. So yeah, but when you're little ones, your teeth are just...
This is RO water. Boo-hoo. Sorry.
There's no fluoride. I'm out. I'm just kidding.
I do actually, when I look for toothpaste and mouthwash, I actually find, I spend like 5 minutes, I look at each box, which has the highest concentration of fluoride. Now, is sodium fluoride, I think it usually says sodium fluoride.
There's sodium fluoride, there's stannous fluoride, and then there's another one. I can't remember which it is. The most effective fluoride for sensitivity is stannous fluoride. I recommend any product with fluoride in it, because those fluoride ions are they're going to help strengthen the teeth against decay. There's a reason why it's in all of these, you know. I had a buddy of mine, and he came to see me. He hadn't gone to the dentist in like 10 years, didn't have a cavity, you know. And I'm like, awesome, you know. He had a very holistic girlfriend who wanted him to use this natural toothpaste with no fluoride. Within that year, he had a cavity.
Oh, geez.
2 cavities, I think. Yeah, that's
wow.
A byproduct. You know, I mean, it does its thing. So it's very frustrating when people come in and they're just so anti-fluoride. I tend to be, so when it comes to political views or religious views, I agree with everybody that's in my chair. Yeah, you're right. Yeah, me too. Yeah, I'm not going to argue with my patient. My reason for being there is for their health, not for my opinions. But when it comes to something that has to do with their health, I will sit there and educate them, because fluoride is in apples, it's in fish, it's in tea, and you don't know where you got your Coke from, where it was sourced. It could have fluoride in it, you know, naturally, you know. So what is your stand? You know, and then there's just, oh, well, there's these studies. Well, yeah, because the rat ate its body weight in fluoride, of course it's going to die, you know. So come on. So yeah, to me, I do think it's hugely important, especially for little ones, because their teeth are still forming, and their adult teeth are forming. So they need that fluoride to strengthen those adult teeth. So one, you know, good point for insurance pays for that fluoride for the little ones to prevent cavities. Does that make sense? Insurance will pay for it under 14 and under, because their teeth are still forming, and having those fluoride treatments help strengthen. So insurance will they'll pay for it, because it's a known fact. Like, it helps your teeth. As an adult, it also helps strengthen your teeth. It's not absorbed as well as when you're little, but it still helps.
For immensely. Children, is that part of the 6 months checkup, or will the parent have to? The parent
part of the 6 month checkup. It depends on the insurance too. Some only do it once a year, and it depends if the kid's prone to decay. We'll let the parent know, hey, it'd be a good idea to give them fluoride more than, you know, once a year. And I think it's like $25.
What's your thoughts on people buying bottled water like crazy?
To the environment? I think it's terrible.
For fluoride.
For fluoride generally, or a lot of bottled water I don't think has fluoride, but it depends on the source. And it also depends on the filtration system that they use. Yeah.
Interesting. Yeah. Was it Dasani? I forget which one, where it's actually tap water that they're just bottling. I don't.
Probably Dasani. I hate Dasani, but
I might be wrong.
I could be wrong too.
Forget which one. There's a brand that was just rebottling tap water. And not too many people know. But
granted, tap water in certain California tap water is way better than ours, so just fresher tasting. So
yeah, I wouldn't. The RO water here, because I heard.
Cheers for the bougie water.
I heard that the hard water here in Vegas, not the
can
liver,
affect your kidneys.
Kidneys, there you go.
Because it's a filtration for and there's the water here is pretty harsh in general. Yeah.
I don't know how true that is. I've heard it, so I'm
not a specialist. This is not my area of expertise. You're going to hear my opinion right now. Yeah, it's pretty hard. I used to live out, so I've lived here my entire life. We used to get well water, and it's just brown. There's just so many minerals in it, and for your kidneys to have to filter all that out. Well, none of the other things that your kidneys have to filter out, like soda and all the chemicals and stuff. It's already, that's still quite a bit. So, yeah, I could see where that'd be a problem.
I wonder about, because I drink RO water exclusively at home because I got the system, and then thinking about the tap water with the kidney problem, so I don't drink the tap water, but then I'm missing fluoride. Yeah.
Well, but you know what? Like I said, as an adult, if you're prone to cavities, then that's when it's more of an issue. And not only that, ingestible fluoride is more beneficial to a little one than it is for an adult. For an adult, applied fluoride that actually goes on the tooth, like your toothpaste and your mouthwash, that's more beneficial to you than drinking it. Okay. So you're okay. You're in the good.
Okay.
Yeah.
Okay.
Yeah. 100%. And they even have, for little ones, they have bottled water that actually has fluoride in it. And then they also have pediatric dentists can prescribe fluoride tablets or drops for water for kids who are more prone to decay too. So
this fluoride controversy, so many things from QAnon to maybe even aliens, people that think aliens exist. I don't doubt that aliens could exist, but we don't have enough evidence to say that they do. At least, I don't think there's enough evidence that say that they do exist.
You're an IT guy. You're all about facts. Prove it to me.
Yeah.
And then, side note, anyway, go ahead. I feel like don't need to know about my dating life right now. But go ahead. Speaking of dating, no, go ahead.
I feel like the controversy on everything from, what's some of the recent ones, just in the news, Trump. There's just so many things that we could throw controversy on. I'm coming to a blank right now, but
you mean all the different
just anything and everything.
The hate that's out there, and
cancel culture.
The uneducated opinions of people with very loud mouths, and it's unfortunate, but because they have such a loud mouth, people tend to listen to them more.
Yeah. So fluoride's fluoride.
It was such a hot issue for so long, and people still have that stigma with them too. That they think that it's poison. No, it's not. So yeah.
So do you get? I'm guessing. So you're saying for a while, patients would come in. They would ask you about fluoride.
Does that paste have fluoride in it? Yes, it does. Should we not polish you? Okay. Done. They're older, and it just depends on the person. I'll try and educate them. It's if you don't want this paste, better watch what tea you drink, better watch what bottled water you drink, better watch what Coke you drink, anything that's bottled anywhere else. Fish has it too, by the way. So if you really hate it, cut those things out of you. Apples, 100%. That has fluoride in it. So, unfortunately, we have to do. Not unfortunately, it's just. I've never written so many papers in my life as when I did in dental hygiene school. Never. Yeah.
What do you consider
all research, all of it, but it's all very beneficial. So
yeah. Mm-hmm. What do you consider the gold standard for home care? If I start asking questions, you still want to elaborate on the last topic, feel free to elaborate, cut me off, and if there's anything on the last topic that you want to say.
I'll cut you off. Okay. No, I'm just kidding. I'm totally kidding. So gold standard for us.
And I'm the grouchy one without coffee.
I even ate too. There's no hangriness going on. So gold standard would be an electric toothbrush by Oral-B.
Okay, I was going to ask about electric toothbrush. That was one of my questions.
So So for your teeth, gold standard would be an electric toothbrush, whether it's Oral-B or Sonicare are my two favorites, and using a water pick, which is a water flosser. That would be it. There are people who can get away with just a regular toothbrush. A lot of people can get away with just a regular toothbrush. Always make sure it's soft. People feel that the harder it is, the more clean it is, when really you can brush your teeth to make your gums recede and expose the roots of your teeth. And that can be a problem later. Then you have all this sensitivity going on. So you never want to use a medium or hard toothbrush. And it's so funny because patients will be like, well, why do they sell them? I'm like, well, why do they sell cigarettes? People buy it, they're not supposed to, but yeah, I mean, yeah, they are sold, but you're not supposed to use it. But yeah, that would be definitely gold standard, is using those two products. Water picking with flossing would definitely primo. That's
like premium.
Yes. Or I can't
platinum.
get people to floss half the time anyway, and it's just like, so baby steps.
So my thoughts on the electric toothbrush. It's just really interesting that, because part of the question was just, I was going to ask, what's your thoughts on electric toothbrush? Are they far superior than a regular toothbrush? But you said some patients can get away with just a regular toothbrush, an old fashioned.
So they're superior. So the vibrations from the toothbrush, the vibrations in your saliva will help create bubbles, and it'll help lyse. When I say lyse, it means break the cell wall of the bacteria and kill the bacteria. So that's why it can be better. Also, some people are super hard, even with a soft toothbrush, can really start brushing way too hard and causing that erosion of the gums to make the roots get exposed. And what I like about the toothbrush is if you push too hard on it, it yells at you. It's like a big, it's like, oh, they got to back off. Yeah. And it also is a timer, which some people, they think brush, and 20 seconds they're done. Really, you're supposed to spend a full 2 minutes. There's a timer on it, and it beeps at you when you're supposed to go to this section, to this section, to this section, to this section. So there's more benefits, not just the brush. It's like the physical brushing itself that is superior. But the fact that there's a timer, the fact that some people need that, there's one, I think it's Oral-B. They even have an app where you can sit there and look in your phone and brush and it'll yell.
I have that.
Good job.
I don't use it. I don't use it. It came with a like a timer that you it has the app and a separate timer that you stick to your mirror, and so then you could just watch the timer as you go, and it has a little smiley face on it. I think it tries to. I think
it also tells you how often that thing goes off and whether or not, doesn't it?
Yeah.
Like whether or not you're brushing when you should and how long you should be brushing. Kind of like that.
Yeah, the smiley faces. I think it's supposed to, like, if you stop before 2 minutes, it's supposed to like turn the smiley face to kind of an unhappy face.
Big brother's onto you, so get your act together. Yeah, no, I get it. Yeah, no.
It was unfortunate for me. I didn't really. I heard electric toothbrushes were good for a long time, and then it was probably about 7 years ago when I finally bought one. But I think they were out for like 15 years now, like electric. No, right? About 10, 12 years?
More than 20, because I remember Sonicares in school and having to research those. And they've been out. Water picks have been out for like maybe 40, 50 years. Definitely not the models you see today, but they've been out for a minute.
Do you happen to remember by chance when electric toothbrushes were kind of getting mainstream, and was there any like knowledge that some of the electric toothbrush weren't that great, like maybe a certain model?
Well, there's still ones out that aren't that great. You've got, but it's all gimmicks and sales, and there's battery operated ones that I haven't really seen any. They're like, oh, I use a battery operated one. Yeah, it's not doing it all that great for you. Either stick with a regular toothbrush or get an electric one. The battery, I mean, sometimes if they're brushing well with it, but I don't see spending the money. I would rather you just get a regular toothbrush than spend the money on a battery operated vibrating one, because it's not going to be anywhere near the vibration you're going to get from electric toothbrush. Yeah. However, though, there are some people who have sensitivity in their mouth to vibrations and they can't do it. It can be difficult the first few times you use it, but generally your mouth will get used to the vibrations and you're fine. But some people just cannot get used to it, then no problem, then just stick with the regular toothbrush.
Just to clarify, in case when you said battery operated, I'm like, wait, my Oral-B
It's a rechargeable battery.
Yeah,
So I'm talking about like the ones that you get from they have kids ones and adult ones where it only lasts for so long. It's got a battery in it.
But it doesn't hit the frequency.
Exactly.
Yeah, for the frequency, from my understanding. Correct me if I'm wrong.
The frequency to be killing the bacteria in your mouth. So
to kill the bacteria, and then also.
I'm not saying it doesn't do anything. I'm not saying that. I just prefer my patient not waste the money. If it's cool and it gets your kid to brush your teeth, by all means, let's use it. You know, it depends. You know, if it's cool and you think it's cool and it'll make you brush your teeth more, then by all means. So I'm all about cleaning your teeth. So yeah.
Think about 5 years ago, I saw an electric toothbrush that was titled as I forget the name. I think they're calling it supersonic. So sonic or
Sonic Fusion. Because Waterpik came out with a pretty amazing one, which is a Waterpik and an electric toothbrush in one. And I haven't had a ton. It's like $200. I haven't had a ton of patients use it, but the ones that I've had, I've loved it because they can use the electric toothbrush to brush, but they can also use the Waterpik at the same time. So it's getting in between and brushing.
Can you brush and have it on? Like it literally does both at all 2 in 1? Mm-hmm. Huh. The one that, from my understanding, electric toothbrush, I tried to do some research on this because I was curious and I actually did buy it. I don't know if the results are good or not. I ended up losing the toothbrush on a vacation, which was lame. So electric toothbrush, I don't know the numbers, like something like 4,000 or 5,000 hertz or something that it vibrates. And then there's this one that does it 10,000 or something. I forget the numbers. And they're saying that...
Vibrate your teeth right out of your mouth?
Yeah.
I don't know.
They're saying it's supposed to penetrate the bacteria and it like gets further and does a better job. So have you heard that? I guess it sounds like maybe you haven't.
What brand was that?
It was some Japanese brand that I'm guessing
because what we use in the office, we have a machine. It's called a Cavitron, and it goes 20 to 25 to 30,000. But that vibration at the end of a metal tip we use to knock off the buildup around the tooth. And there's water that comes out. People kind of confuse that with a Waterpik, which it's not. Yeah, you're good with the regular. I don't think, because they're pretty strong, and I don't think people really like stronger than what that is. No, yeah, it's in your hand, so it's like, you know.
This one, it was kind of weird. This one was.
Did you use it?
Yeah, I had it for.
Okay.
So I only had it for about a year before I went on vacation, and then I left in the hotel internationally, and then so I just lost $200. It was actually pretty cool because it was actually
busted it out and showed me. I'm such a nerd. I'd have been like, it was from Japan.
Yeah. So yeah, I could find it.
I have to look into that.
I'll find it on my Amazon buy list. But since I searched later on, I'll show
send me the link. I really want to check it out.
I think I don't know if they're still selling it, so maybe that shows that it's not working.
Yeah. Well, I'd like to see the reviews on it too.
Yeah. I did prior to buying it. I did read the reviews, and people were saying, "Yeah, this really works." But I mean, reviews are reviews.
Yeah. I like to see the bad ones and really kind of gauge. And then when I see bad ones, I like to see what else they've reviewed on. Are they all bad ones? Or are you a mix? Like, are you?
Whoa, you're deeper than I go. I usually I do is I usually just read like I'll read 50 of one product, so I get a feel for that one product. But it'd be interesting what you're saying. Follow someone that gives a bad review and see if they're consistently bad.
Just negative Nelly over there, or if they just they're being honest about it, and that to me is more honest if you have different types of reviews.
That's
my thinking. So when I spend money on something, better be for a reason.
Yeah.
So.
What's the worst type of dentist you've worked for?
The worst type, the ones that we were talking about, the unethical one who only would do crowns, or I had one dentist, and I think it was more personality. Like, he was good with his work and stuff, but I swear he would sit up at the front office and make us all listen about his issues with his ex-wife, and I was like, really, dude? He was Vietnamese too. Just saying. No, I'm just kidding. You were going to ask me about the Vietnamese culture. No, but
That's going to be your story.
Yeah, that's my only experience, really. Oh gosh, it was awful. It's like, I really don't want to hear about your mother-in-law and your wife, and she buys so much from Amazon. And I'm like, can I have a break? I'm gonna go clean something because I don't. Yeah. That was just annoying, if anything. And yeah, he used to kind of trash. I shouldn't even say that. That's unprofessional of me. So no, yeah, that was just the annoying part and the unethical one. Yeah, I'm just not.
Okay.
Yeah.
Let's go with what's the best type of dentist you worked for.
The one I have now, for sure. Like I said, he has a great bedside manner. Very gentle, but he knows his stuff. He does great work. I mean, it's just impressive. And it's very nerdy because I will look at it like when I get the patient after they've had the work done, I'm like, ooh, that's pretty. Like, do you know how pretty that is? Like, he did not just slap that together. Like, he's definitely naturally talented in his field. And I've had that experience with maybe 3 dentists in my career where I was just blown away at. They were just so ethical, had an amazing, and they cared about the patient. It wasn't about making the money. Yes, it's a business. However, they cared about the patient. And I've seen dentists go and volunteer, because hygienists, like, they're usually more hygienists volunteering, for various, community cases, but I'll see those same dentists out there volunteering as well. And that just, it's like, so yeah, I definitely work for one, but yeah, I've had quite a few.
I would imagine, I wonder if becoming a dentist or any profession that takes that long, that much schooling, I wonder if some of them, I'm thinking like politicians, you get jaded and then you start just not caring about people, or you just want money out. But
possibly I've seen doctors do that where they're close to retirement, they're just burnt out. I've heard stories of dentists who are just burnt out and and kind of jaded because people, especially nowadays, are very litigious. And I've seen people sue very good dentists for ridiculous reasons. Number one being you don't take care of your mouth, and so things failed in your mouth for a reason. That dentist did everything they could. They're ethical, and then you see good guys get hit. So even some hygienists now are getting hit because, like, it's unfortunate, but we have to cover ourselves, and sometimes have them sign consent forms. Like, if you do not take care of, what we're, doing, it can go back to it. Just because I clean your mouth doesn't mean you can stop brushing, some people think that. And it's the same with the dentist. Like, they have to, it's kind of like when you go to the hospital, they have to tell you what the worst case scenario is, and you have to sign off saying this could be the worst case scenario. So, I mean, generally it's not as, harmful to the extent of going in for surgery, but still, things can fail. Like I said, people are litigious, and I can see where it can beat somebody down.
Yeah.
Really great people, it can beat them down, especially, patients who are sit there and tell you, they love you. Cause I've seen that happen before too, where a very solid, loyal patient is like, and then all of a sudden, somebody drops a hint, and then they're money hungry, and all that, loyalty, that's gone in a heartbeat because they saw dollar signs and, they want to go after you. Never mind that, he's got bills, he's got overhead, he's got, all these kids and that he's got to pay for. Like, this is his career. Yeah. Like, really think twice, but people are people.
What did you do specifically for Crackdown on Cancer? So what is Crackdown on Cancer?
That was the one where we went to the Nevada teens on smoking, and we went. But that one ended up being really good. That was the mobile dental clinic where we did tobacco education and oral cancer screenings, because we went from number 1 in the state during that time period to number in the 40s. So yeah, it did. I think it had a huge impact because it wasn't just individual oral cancer screenings, but we had to go in. And it was funny because when I went into school, one of the things, our prerequisites was speech. And I'm like, when am I going to have to do a speech in front of people? I'm doing one now, but I was just like, what is speech for? Well, I've done continuing education classes for my peers, where I've had to, actually, it was on that particular program where I taught, other hygienists and some dentists about what we did in the field, how it impacted, our state. But we went into the high schools, and in their high school auditorium, we'd have it was mostly the health classes because that's when they dealt with smoking. And we would do speeches and talk to these kids and find a way to kind of, and like I said, it worked because we went from number one and we dropped our numbers like significantly. I mean, we weren't the only reason. There were other tobacco programs out there, but every week, I remember we traveled all throughout the state. I learned how to drive a 37-foot Winnebago because of it. So yeah, yeah, it was pretty awesome.
Tangent story, just because you mentioned, shoot, I even forget.
Smoking,
what.
Teenagers, buses, what?
Yeah, I don't even know. I'm just going to say the story. I don't remember why.
Okay, tell me the story. I went drinking last week and...
learning speech. Why are you learning speech?
So, yeah.
Something that with IT I thought was interesting for me was just, I didn't really take English itself, like writing emails or writing essays, seriously all through my childhood. And actually, I was fortunate to be at with the internet and everything. I was able to forge or plagiarize every single essay throughout my whole childhood.
Your own essays? Wait.
Like I would go on the internet and get essay ideas and just copy and paste, and nobody caught me because the internet was so fresh at that time, and nobody caught me. So
wow, confessions of your interviewer. Okay.
So my 20s,
nowadays, yeah, totally different now.
Yeah, in my 20s, I felt like I wasn't very good in the office setting, like writing emails, kind of talking to people, and I started maybe around 27. I started taking it more seriously. I don't know what it was. I just wanted to learn more and get better at everything that I'm involved in. So then around 32, I feel like I started getting in a groove of just writing. The way I wrote emails, the people at work, the corporate environment, how people would respond to me. Now, granted, it could have been because I had more years in IT, but I feel like there was oddly some compliments from managers saying, "Oh, this email was so well prepared and you got to the point. There was no ambiguity at all. There's no way anyone could misconstrue your point."
Yeah,
and
because some people will stop themselves if they feel like how it's written, they'll be more about how it's written and not even pay attention to.
I hate that. I understand it.
So I get what you mean. So yeah. So you had to teach yourself instead of going back and learning like the rest of us. I guess I was just not the brightest kid because I actually sat up at 2 a.m. I'm old, so I was on the typewriter with the correction.
I think I only
and
had
white out. Yeah. So
I think I only had one essay I had to do
like that
with the old
painful.
Yeah.
Like my parents like that, because they could hear it across the house.
Yeah. The erase button because it was
loud. Yeah.
The erase. We had to use so much erase on that damn thing.
Myself. Yeah. No. Yep. Never thought about plagiarism back then. Could have done it. Could have gotten away with it.
If I had a
nowadays, teachers just put it in a program.
I
remember, not total different tangent. This guy I was talking to, he kept sending me poems, and I'm like, they were pretty elaborate, and I was like, that's kind of cool. It was kind of weird. I don't know. Not used to getting poems sent to me every day. But at the same time, it was semi-romantic, and so I was like, cool. And I'm like, did you write these? He's like, yeah. And I'm like, that's pretty incredible. And one day I was like, cut and paste. There's a book. Cut and paste. There's another book. I'm like, oh. So interestingly enough, and he's like, oh yeah, I wrote this book. Bullshit. You did not.
Compulsive liar.
Block and delete. Yeah. So speaking of plagiarism, it works in many different aspects.
Yeah. Looking back on high school, I think I was focused on. Every kid wants to go out and play outside or of some sorts. Play.
Back then, Not now, but back then.
So my goal was to spend the least amount of time on homework but do all the homework. So
Yeah.
I like started finding like shortcuts and everything. Like I started figuring out certain teachers would do, they would take the exact sentence from the textbook and just, so certain teachers, I would learn that I could look for that same exact sentence. I would through every page that they told me to read,
Yeah.
look for that sentence. Like, oh, there's the answer. Okay.
Yeah.
So
write it perfectly in. You figure out your ways. But that's a kid who has a goal set in mind, and it's going to happen. So by any means possible, plagiarism, looking up your teachers, no. Good. You know what? We all have to figure out ways to get through life. So there you go.
I mean, when I look back now, I wish I would have done the research and learned more, been more.
Hindsight is 2020.
Yeah. Yep.
For sure. Not to be cliche, but it is a true statement.
So this next question, I think I get the feeling that you love your job, and I'm pretty sure every viewer does, but do you love your job? And if there's anything you want to add to it?
Do I love my job? 100%. I do. I don't mind getting up out of bed. I mean, okay, there are days, yeah. But I really don't mind, like, once my face is washed and I'm in the car and I'm jamming to whatever I'm jamming to on the way to work, I'm just like, hey, and I walk in the office, you can ask anybody I work with. I'm in a great mood. I'm always, messing with somebody, teasing somebody, being sarcastic, whatever. But I love it. And, and I love the days where I have patients that are just, they come right back at me and I just have a great time. And then, and I love it. I'm such a nerd about it. Like somebody who's gone from, complete unhealthy mouth to completely healthy, and knowing that I had some small part of that, I really nerd out on that, and I really do love it. And I know that also, I mean, there's just so many different dynamics to the mouth. There's physics to it. I mean, there's just so many things to it, and finding out any pathologies, that sort of thing. I'm just like, it really gets me super excited. If you put me in a room with other cool hygienists, we can talk for hours about teeth and patients, like how we did this or how we did, not patients, like about patients, but we can talk about it like all day long. And I do 100% love what I do. Yeah, I don't know if I'll ever fully retire. I may still do 1 or 2 days a week just to keep, I think I'd go nuts. Quarantine was hard for me, because it's a fast paced, job. Like you're constantly on the go, and to be sitting your butt at home for 3 months, that really, or 2.5, yeah, it sucked like big time. So yeah, I like it a little bit.
Do people premeditate before seeing you, and what do they do to help ease the anxiety?
I have people who, do different things. I will let them know, like if I'm going to do a longer procedure, bring your earbuds in and listen to your meditation, your music, rock out so you don't hear me scraping, because a lot of the anxiety is just lying there numb and just hearing everything that we're doing. So I'll tell them to do that. Some people I don't even have to tell them, and they'll listen to their audiobooks or what have you. Some people do kind of zone out and get in their own space. And so a lot of being a hygienist is reading people and knowing they don't want to talk to you. They don't want to hear you. They want you to do your thing and let them get out. And I totally get that. Some people want to jibber jabber through the whole thing. And I'm like, okay. Are you done yet? Okay. Yeah. So, common complaint of people is like, oh, my hygienist asked me questions, and they're still in their mouth. I never have done that. Like, I know they have to respond by talking. I will take my, okay, Yeah. But like I said, some of them premedicate with smoking or they have no qualms being like, I took a Xanax, cool. You're driving. Okay. Like maybe you should have someone pick you up. Like, yeah.
Is that the 10% that are the kind of like the mean patients? Are they a part of that, or is that a different subset? Like meaning the people that come in fearful, anxious of the appointment. Is that
I 40? Wish they would think about pre-medicate or doing something, because they come in and they're a bundle of nerves, so yeah.
What's the percentage on that? 80%?
That are a bundle of nerves?
Yeah.
It varies from day to day, but overall,
just
maybe
ballpark, what do you think?
25%.
Okay.
So it's not a majority of my day, but I always get patients that are just like, Yeah, not the mean ones, but even them, the super anxious ones can be mean, but it's just not, that's not who's talking, it's the fear that's coming out.
Yeah,
So
I want to say like,
get drop down drunks that come into that either, I'm like, yeah.
I wonder if it's just people are more vocal about it, but like say when I'm in the office at work, like out of all the places I've worked through all the years, like I want to say it feels like 95% of the people say that they dislike going to the dentist. And I don't really, I dislike just as much as I dislike going to the car mechanic, as much as I dislike it, or as much as I dislike cleaning my room. To me, it's a chore.
Mm-hmm.
So going to the dentist is a chore, and not that it's just.
So again, there's about 10% of people who love coming in, and I love these people. They're just like, tell me all you gotta tell me, and I'll tell them. You know, they love coming in, and generally their mouths are just ping, just pristine because they love coming in. They will say just that. Like everybody says, I hate coming here, but I love coming here. I'm that nerd too. I like going to the dentist, but I know what's going on. But yeah, a lot of people love it, but yeah, a lot of people find it an annoyance. But it's one of those things that once you're there too, it's not as bad as, you know, I get that a lot too. Oh, that wasn't as bad as I thought it was going to be. Like, cool. How bad did you think it was going to be? You know, but
yeah. For me, I it's a chore, but I don't mind it when I'm there. I don't even
once you're there, then it's usually fine.
I don't mind it. Yeah, I don't mind it at all.
Yeah.
There was only one scenario, one time ever. I don't know what they're shooting me up. I think it was a needle that went into my gum, and I don't know. It hit something, and it was one of the most painful things. My ankle was way more. Breaking the ankle is way more.
But it was a shock.
Yeah. I grabbed the hair, the chair armrest, and I like grabbed it. And I was like, oh
yeah.
Later on, I told someone that story, and they said it's probably that dentist went in way too fast. Like if he just went slow, that's what
No, not necessarily. Sometimes, so your anatomy for everybody is a little bit different, you know. Or some people have, you know, big noses, some little ones, and so the anatomy, like we're dealing underneath where we're going blindly in there, not to sound. It shouldn't sound scary.
Unprofessional, but
but we're blindly going in there, sticking a nail, knowing where we're, you know, the most experienced oral surgeon can nick a nerve, and that will send a shock, you know, into you. Just back off a little bit, redirect, and go, you know, because everybody's saliva glands, your nerves, there's a lot of things going on underneath there. There's arteries. We're trained to deal with it. If we, you know, happen to nick something, you know, how to deal with it. I've been, you know, knock on wood, 20 years, I've never had a problem ever. You know, there is always a very tiny percentage of like paresthesia, where it's permanent. And I've had maybe 2 patients that it wasn't from me, but they went to an oral surgeon or what have you, and they had paresthesia where it was permanent numbness, like for life, because of, you know, a needle going in.
Oh, wow.
But that's one of the risks. It's just one of those things, you know, it's like going under, you risk, you know, when you go under for surgery, you risk death, basically. Worst case scenario is that. Mind you, I've also had where I'm pretty good at getting my patients numb, but I numbed one patient so much that she couldn't close her eyelid because it was just numb, because there's so many nerves and so many blood vessels all interconnected. And so, you know, sometimes I'll numb a patient and half their nose is numb too. You know, that's just how their nerves are lying.
Yeah.
And this one, like, it caught her eyeball. I'm like, sorry. She's like, can you tape my eye shut? Like, I'm so sorry. You know, but she flew through like her procedure. She was numb, you know, but I mean, it just happens, you know, it's just one of those things.
I guess it's just a calculated risk. I mean, as much as we go driving in a car is probably way more dangerous. More dangerous.
Way more dangerous than getting your teeth done. Yeah. So the incidence of anything happening, that little zing, you know, it's happened for sure. Yeah. And then some people, they freak out, the anticipation, and they're just so nervous about, and then there are people who just have a huge fear of needles to begin with. You know, I've had, you know, a guy who was in Afghanistan getting shot at tattoos all over the place. But when he heard me, he didn't even see the needle. I set it behind him and he just started hyperventilating. It's just a true fear of it, And so I have people too. I go and they're like, oh, and I'm like, I haven't touched you yet. So you want to maybe just take a deep breath and relax for a sec, But I mean, again, it's that true fear that's just.
Yeah. I think it was a couple of years after that needle hitting the nerve. I went to a dentist appointment and I don't remember how many years, but I remember my reaction.
Anticipation.
Yeah. I was like,
waiting for it, and then it went okay.
Nothing. Yeah, exactly. Afterwards, I told the dentist, I was like, I was so fearful of that needle because the last time something happened, it hurt so bad. And I think that's where he said, "Oh, the other person probably went too fast." That's what he said. So I don't know.
Yeah.
What? How does nitrous, aka laughing gas, help?
It helps calm people down. Some people think it's going to take the pain away, but it doesn't. That anxiety, it's not as commonly used as it used to be. I feel like there are people there that come in just to get it, and they're like, "Oh no, I need it," and I'm like, "You don't seem nervous, but okay, and." I need it higher. And it's just like, yeah, there's legal limits to this. So, but generally when it is used, it's to calm people down and just kind of make them relax so they don't care as much about what's going on. And it's one of the things too that you can use that you don't need to be driven home afterwards. We just put you on oxygen afterwards and then you're fine. But it kind of helps ease the dental appointment for extreme cases, I feel, mostly for people who aren't used to it. People who are too used to it, that concerns me that there's some kind of issue going on there, but yeah.
So is the laughing gas?
They call it laughing. So if you have too much of it, you can laugh and not be able to stop, like hysterically. That's more of a side effect of an overdose, and they just call it laughing gas. So that's why it got that name.
Does at a certain point does it put someone to sleep at all? Like not kill them, but it just like do they fall asleep or?
Sometimes it can get so relaxed, but then I've had patients get so relaxed because they're numb and they don't feel what I'm doing and they get bored and they pass out. I've had patients pass out when I'm just cleaning their teeth. I have God bless her. I'm a patient. She's got 5 kids, and I swear that woman, she just passes out, starts snoring, but she's able to keep her mouth open. So I clean her teeth, and she's good. So yeah, I mean, yeah, some people just pass out in general.
Is there a reason to give the laughing gas, or what's the reason? Like, so are they just
anxiety?
That's it. That's strictly the only time it's kind of used there. Okay.
Extreme anxiety. The pain is more is when you get anesthetic, so you're not feeling it. So
okay.
So you're numb and don't feel it. Anxiety is more what the laughing gas is for.
So if anybody that goes, they can request laughing gas?
They have to pay for it.
Oh, okay.
It's not cheap.
Oh, okay.
It's a pain to set up, but there are people who legitimately need it. There are people who should not be using it. Yeah. Depends on your reason for needing it. So, yeah.
I wonder if I've ever had it. I don't know if I've ever had it.
If you've gone through your appointments, I wouldn't. There is an extreme, like there are certain people who can't use it because it can cause instantaneous miscarriages too. So people who are pregnant, like when we use nitrous, they just generally leave the building. If we have staff that are pregnant, they just don't, they leave the building or they're on the opposite end. There's certain requirements and systems in place to take up that. Yeah. But I mean, I'm not saying, I shouldn't say it that way. Like our system is equipped so that it's not like out in the air, you know, but sometimes patients, it's like, you're like, all right, just breathe through your nose. And they're like, okay, I'm like, great, guess I'm getting high today, No, I'm just kidding. So, yeah.
What daily habits do you have that greatly improve your life?
Daily habits that I have. So there, I have, there's an app, it's called...
Brushing your teeth, sorry.
Well, that improves everybody's life. I think that's a given in this conversation. Yeah. Gosh, I can't even count in one hand probably the night. I never forget to brush my teeth. I'm just weird about it. I think I know what goes on, and that's why it freaks me out. Knowledge is really power.
Or debilitating.
True. Very true. So true. one of the dailies I do, I have, there's an app called Insight Timer, and there's a morning meditation on it that's like 10 minutes. And it's really like this guy's voice, it's so soothing, but it's just about, kind of motivates me, kind of sets me up for the day about, just, it talks about, let's try and incorporate, different habits, make sure you're listening, to people, like really listening to people, make sure you're eating right, make sure, you're trying to get movement in during the day, things like that. It's like 10 minutes, but it gets all this information in, and it's just, I feel it's pretty awesome. The other thing I have is just this little journal. I got it on Amazon, and it's just basically, studies have found that if you find something grateful for, especially at least 3 things you're grateful for every day, it really improves your outlook on the day. And it really does. You can be a head case over something and not really sit back and realize, I'm fortunate. We're fortunate to live in this country. We're fortunate to have a roof over our heads and have food, excess food. My child is healthy. I have amazing dogs. I love my family. There's so many things to be grateful for instead of bitching about ABC. So yeah, I would say those 2.
Awesome.
Plus my dogs, they're just so unconditional love. Not so much my teen. It's very conditional love on that end. But no, I love him. He's a super awesome kid, but my dogs just love me no matter what. And they just make me happy every morning. So
awesome. What do you find most interesting of Vietnamese culture, or what do you know of Vietnamese culture? And if you don't know much, it's okay.
I don't know much. Like I said, I had one boss who was Vietnamese. I know you're cool. Food. I do remember, though, with my boss, his parents were really big on bamboo plants. And I thought that was kind of neat. And like, if he had a bamboo plant, he was like, oh, this tradition is just, BS. But he was very careful about the placement. You can't just throw it in the trash. Like, you have to, I don't know. I was like, oh, that's kind of neat. Like, just, I don't know. And so that was kind of cool. Crispy egg rolls. Yeah. But aside from that, there isn't a whole lot that I know.
There's a lot of tradition still currently in the Vietnamese culture, like, meaning, I guess when I say still currently, as the generations, I guess when I think about the internet and the movement of things, how fast things are moving, I thought that certain Vietnamese traditions would kind of
go to the wayside.
Kind of, yeah. But it didn't quite move as fast as I thought. Whether for good or bad, it's probably, most people would probably think good, because they like that most people say tradition's good.
Mm-hmm.
I love
like different cultures. I love their traditions and the reasons for those traditions. There is a reason for those traditions.
Yeah. There's a real interesting one that I I discovered when I was there last time 2 years ago. They have this saying, or this culture, don't take a cold shower out after being outside in the sun. But I heard it so much because a lot of the elders will say, when I'm over there, because they know I'm a foreigner, so they want to be nice and take care of me. So I hear it a lot.
Give you the advice.
Yeah. They're like, oh, you were just outside for a little bit. Don't take a cold shower. Like, I may I might come home to my uncle's place over there, and then I'm like all sweaty. I want to take a shower, and they're all like, huh, don't take a cold shower. Be careful. I'm like, what the heck is this? What is this? And then my wife was on Facebook, and she was showing these videos of like people passing out from heat stroke, because in Vietnam it's pretty hot, and a lot of the labor is really harsh. So it was interesting to kind of connect the thoughts. Like,
there's a reason for the advice.
Yeah.
And sometimes whether or not they know the meaning of it, they know there's a reason for it, so they're going to pass that on.
Yeah.
So I get it.
Some of it I like. They have one where don't sleep with the fan on. They say it'll kill you. I'm like,
I'm not dead yet.
Yeah.
Kind of a freak about that too. It's like, I hate dead silence, no circulating air. So yeah. So tell me, what is it about the Hispanic culture that you know, Mexican culture?
Oh, you're gonna turn this on me?
Absolutely.
Oh man. Okay, so I find it's interesting where So in American culture, I feel like the family unit isn't as strong, and I find that Mexicans and Vietnamese family units are stronger. Um, and this is something that I dislike about the Vietnamese culture when they say bad. I don't know what Vietnamese people. They're like harsh. They're racist almost. Like
I think every culture within itself is racist against other cultures.
so, my parents
Not in a always completely negative way, but they just feel. I think every culture thinks there's a superior. So yeah.
Either I don't remember if it was exactly my parents. I'm gonna call them out all over the internet. I remember them when I was younger. They would say like, "Oh, be careful, Mexicans." Though, but they would say it about every race too. They'd say about blacks, about. Did they ever say much about white people? But they would say stuff like, "Oh, be careful, those Mexicans. They may steal something from you." And I'm like, as I grew up and I saw
check your pockets for it, dude.
Shit. As I grew up and saw the family unit, I started telling my parents like, "Hey, you guys should look at their family dynamics. It's so similar to ours. Like, you talk you're racist on so many races, but you need to look at these other races and realize there's so many similarities." So
I think in all cultures, if they would allow themselves to, they would see those similarities and maybe look at other cultures a little differently.
Yeah.
But it's so easy to, put some kind of, what's the word? I forget what the word is.
Stigma.
But yeah, stigma or, I can't even think what the word is, but it's so easy to sit back and judge and sit back and say this, that, or the other and not really know. It's so much easier. I mean, people do it on the internet all day long.
Yeah.
So.
And then recently, my wife, how did we come up with this conversation? We were talking about in Vietnam. There's a lot of street vendors. Now I've only been to like TJ area in Mexico.
Lots of street vendors. Yeah.
Yeah. So
yeah, go ahead.
So then she started asking when she came to America 2 years ago. She was like, "Is there any street vendors here in America?" And I'm like, "No, not really. I mean, you get some like food
Pockets,
trucks, yeah, but it's not the same though because I'm like the little cart that's frying.
Oh, yeah.
Yeah. So when I went to TJ and then what there's other areas near TJ, a little bit past TJ. I forget the name. Yeah. And get them the seafood there.
Yeah.
But then, so she asked about the street vendors, and then I told her, if you're interested in that, we may have to go to Mexico sometime just for her to get some street. Yeah.
There's a place in town that I was told. My buddy Tony was telling me that he was taken to, where there's a bunch of street vendors, and it's just like everything. If you want your car, like just everything, food, mostly food. He's like, he has had the best food. I'll find out about it and let you know where it's at. But it's like on Saturdays specifically, there's a lot of street vendors. But then, there's also that small, we have the outdoor swap meet, which is ish, street vendor-ish. I don't know, not the same, but maybe have that kind of.
You're the first person to turn this question on me to ask about.
Well, what's your favorite Mexican dish? Told you my favorite Vietnamese dish.
Crispy egg rolls for you. For me, my favorite. I like tamales, but I like carne asada burritos.
Mexican very much? Or?
No. Well, I go to the Mexican fast food.
Roberto's?
Yeah.
They're good. Not gonna lie.
So carne asada burritos. There was actually, I was just talking about this like a month ago, like 15 years ago. They went to this Mexican seafood place in San Diego called Katrina's, and they're still open. So if you guys go check it out for me, see if you can find this dish. There's this amazing, like, I don't know, it was just this big plate with like a bunch of seafood, and it had this red sauce all over it. It was
just bomb.
It was amazing. and then you get a pile of chips, and you could also dip and eat. It was just I still remember. I want to go back. It was so lame because I went.
Kind of need to eat there now.
I went. They have a second franchise location in like Oceanside, but I tried to find it and they didn't have that dish. So I don't know.
Go to the original apparently.
Yeah, I don't know if they still even have that dish. I tried to go on to the menu recently, and try to look for that dish. I didn't see it. So
I bet you could still have it made though. If you're like,
but I don't know how to even
don't you
describe
hate
it.
that?
It
Like
was,
when you have something that's so amazing, you try you can't replicate it ever again. Impressed. Okay.
I like to be pretty open with food. Like I've tried Ethiopian food. I love
Indian food.
Yeah. Have you had butter chicken curry? Holy shit, that's good.
Yes. Oh,
There's
yes.
A place by the airport. What was the name of that place? Yeah, I'll try to find
Chicken
it.
korma.
Yeah.
Oh my gosh.
Yeah.
My ex-husband's British, and there's a lot of Indian culture in England, and Indian food. That's where I was introduced. Funnily enough, love it.
Yeah.
Yeah.
Love all the spices. What do you know or think of cryptocurrency?
So I'm gonna be honest with you. Pretty much nothing.
Okay.
I've heard of it. I've heard, it's the wave of the future. I'm not gonna lie, don't know anything about it.
That's fine. I think.
Are you gonna educate me or?
As much as you want. I'll because I talk about it on every episode.
I guess I haven't got that far enough. Sorry.
Well, no, each episode might be only between from 2 minutes up to 20 minutes.
Okay.
So I may start talking about it, and then I may start cutting it out, because if every episode I say maybe the same thing or similar things. No, I think it is the wave of the future. This algorithm is freaking beautiful. Like, I don't like to use that word very often, because I like to preserve that word for women. Beautiful. But this code is fucking amazing.
Okay.
This code is,
I was like, algorithm? No. Oh, okay.
This algorithm is so amazing that it creates, underneath it of all of it is this encryption called RSA. RSA is like the three guys, like their initials, but there's an encryption that allows for a nearly unhackable encryption key. It's improbable. If for my server, for my computer that I spent a lot of money on, for me, if you gave me a wallet ID and I try to hack that RSA, I did the math. It would take my computer about 1 with 70 zeros with it behind it. That's how many years to crack that one wallet.
So fairly impenetrable, because
it's improbable. It's possible. It's what if some
improbable because is your computer going to last that long?
Yeah. I mean,
there's so many factors to it. Understandable.
It's improbable that it could hit it within the first day that it ran that code, but super improbable, because on average it would be 1 with 70 zeros, and that's how many years it would take for it to crack. Now, take that where these wallets are so secure, and then you also use that for there's nodes all over the world, mining servers. You might have heard mining servers.
Yeah.
So each mining server will be on and running on this network, and say Bitcoin's the most popular one. I'll just use that just for the heck of it. Bitcoin, if you have a transaction from person A, person B, mining server 1, mining server 2, 3, 4, 5, 6, 7 millions around the world. The first one to look at that transaction, and then they'll do the math, the algorithm, to see if account 1 has enough to send to account 2, and it says yes. It does this crazy math, and it sends its signature out and says, hey, I am hopefully the first one to find this answer. Everyone else on the network says, yeah, that's right, we agree. And so there's a consensus. Once, to get technical, there's millions of servers around the world. Some companies will just wait for 70 confirmations. As long as 70 random computers around the world agree to this math, they say we'll take that as truth.
Okay.
If a server tries
the transaction between the two.
Yeah.
Okay.
Now, if someone tries to hack the system, say person A doesn't have 2 million coins to send to person B, and they try to send that transaction to the machine, a good machine will say, yeah, this is bad, that's kicked out. A bad machine will come in and say, oh, that's a good transaction. They do have 2 million to send to somebody, but all of a sudden, all these thousands, millions of servers come on and say, nope, that's not good. So that company waiting for 70 confirmations will never get 70 confirmations for that transaction.
Okay.
So this network is so decentralized, no one controls it. Like, you'd have to EMP the entire world, kill every computer, and bring us back to the Stone Age, which is
fairly impenetrable.
Yes.
Okay.
Yeah. And this decentralized nature has this, what I think is so beautiful behind it is a consensus of truth. This is a paradigm shift to everything that we've been able to. There's nothing like it ever before.
Interesting.
So this consensus of truth, if you have millions of servers around the world being able to tell you, yes, this is true, as long as you could trust the math, but you have so many millions out there. And if you just, even if you want, like most companies go 70 confirmations. If you're anal and you want to say, I want to wait for 500 confirmations, whatever. But as soon as the mining servers find another bad node, they kick them off the network. So this whole network is a mutually
Policing kind of.
yeah. So
Interesting.
with this consensus of truth, this does everything from money, because we know how much is in each wallet, and we know the truth of it. But we also we could do stuff like voting for the president, because if I have a wallet and that's my ID, like this is a little bit, there's a lot of stuff.
In the future.
Yeah.
Okay. No, I'm following. Okay.
If I have a theory of trying to do like your fingerprint with blood, and like so that there's multiple fallbacks. Like if you do a wallet to your identity, and then like I could verify that I own that wallet, and then I could vote for the president, and that'd be all on the blockchain. Like,
and then there's going to be absolutely no argument that there's. Okay.
Yes, except for humans are the bad. It's humans
that are that virus.
Blockchain is an amazing, beautiful tool, but humans have to figure out how to use it for humans, whether they do or not. I think they will. I think they will, because you can't kill it. It's unstoppable. This movement is unstoppable. Eventually, humans will. When I say humans, I mean just the masses of people. I guess governments will eventually, hopefully, come to their senses and start adopting this, But then you get into the economics of fiat printing money. Government likes to print money. You can't print money. With cryptocurrency codes in there, all the mining servers have code in there. And as soon as you alter the code, like as soon as they start trying to confirm transactions, it's not going to sync up the math. And people are going to be like, no, that mining server is not right. Something's wrong with it. Somebody altered their code or something. Let's kick it off the network. So there is a consensus module out of all that. So
how are people making money from it? Because I know, like, I have a friend of mine, he, I don't know, he had it in his garage for years. I don't know if you met Mark, but he had computers running in his garage for, like, since I've known him.
So those mining computers, when they confirm that transaction from person A to person B, that mining server, whoever is the first mining server to confirm that, gets a small fee. It's like micro pennies. Yeah. So the person sending pays the fee.
And it's to that first person only, not the other ones who are confirming.
Correct.
Okay.
There's a little, that gets a little bit more complicated.
Yeah.
There are.
Interesting. I've never had it. Like, I've always vaguely, seen it around. But I've never really cared enough to research. Obviously, you're the first person to actually give me that definition, so that's very fascinating.
And a lot of people will look at Bitcoin, like the price is at $40,000 per coin right now.
Heard about that,
A lot of people say, well, it's too late for them to get in, and I say I think we're at a fraction of the world's money in the system. I think I don't know if 100% of the world's money will go in cryptocurrency, and even if it's 2% or 10%, I think we're at a small sub fraction of that currently. That
people can still get involved. Okay.
And even if this is the beautiful thing I love about cryptocurrency and blockchain,
you got IT guys like you that know everything.
No, I mean, kind of know. Even with this stuff, it gets deep. There's so much I don't know about blockchain, but the thing that I love about it is it's a what's the word I'm looking for? It's a not altruistic system. It's a mutually beneficial system for also a symbiotic system
for all parties involved.
Yeah, like
there's
even
a symbiotic relationship going on that everybody benefits.
Yeah, some people could say, well, you bought so early, it's unfair that I got to buy in early and they're just buying now. And I'm like, well, I think like if Bitcoin's at 40,000. I could see it easily going to $500,000 to $1 million per coin. Will it happen? I don't know. But that's why I see this as a symbiotic thing if everyone gets involved.
So Have you done a show where the layman can actually figure out how to do it?
I've been thinking about it. I don't know if I'm going to. I oddly, for as much as I like to think I know about cryptocurrency, there's so much more. So maybe that's where I need to embellish my resume. Like, I feel like
Jump into it. Go for it. I mean, if somebody's going to correct you, so be it.
Yeah,
you know what? But share your knowledge with the world.
Mm-hmm.
You know, but if you want to. I mean, I find it fascinating. I'd listen. So it's probably a TikTok on it. It's TikTok on everything, I feel.
Well, TikTok's only
interesting.
It's only like 7-second videos, so I don't think I would have enough time to explain it. Do you need any water?
Yes. The non-vodka water? Yes, please.
I could have given you vodka earlier, but you kind of...
I know.
You're afraid to be on air. Don't know what you're going to say.
I don't know if I don't know.
So for cryptocurrency, I suggest if you have disposable income, like meaning, like if you're putting money in a 401k, I'm not a financial advisor. Don't listen to me. I'm a stupid dumb shit. But
I like how you look at the car. I'm a stupid dumb shit.
If you're putting money in a 401k, I think it'd be, I would say it's smart to put not maybe 90 or 95% into your 401k, and then take 5 to 10% put it into cryptocurrency.
Interesting. Okay.
There's a pretty easy ones like Coinbase. There's a lot of fees because it's the easiest, biggest name, but it's easy. Coinbase, Gemini, they're pretty easy.
So it's an investment app, or something?
It's an exchange, just an exchange. You would go in and you would have a US dollar wallet, and you could deposit money, and then you could buy Bitcoin or the other coins. I like Ethereum. I think eventually Ethereum will become bigger than Bitcoin, and that means the multiplications on your money would be more so.
So there's different companies that are...
There's different cryptocurrencies, yeah. Cryptocurrencies are decentralized, so there's no one entity. It's actually, the story of Bitcoin is amazing. Satoshi Nakamoto, the creator of Bitcoin, nobody knows who he is. It's freaking this.
That's bizarre.
It's such a amazing story that it should be a movie. Like,
is there a YouTube on it? I'm sure there is, huh?
There's been some attempts, but not. I think.
Where did you learn it from?
So, unfortunately, my story goes back to 2008 when
that was a while ago.
The Bitcoin white paper wasn't even out yet. So I was a programmer. So my programmer coworkers. So I was a junior programmer at that time. My knowledge of code and stuff was still growing. My coworker comes up, "Hey, what do you think about this Bitcoin stuff?" And I'm like, "What is that?" And he's like, "Well, they just put out this white paper, which is a technical thing. It explains how to do the consensus and how mining will work and all this." And I'm sitting there, I'm trying to think about how someone would program that. I didn't know about RSA encryption back then, which I wish it's actually RSA encryption is, if you have a phone, if you have email, anything on the internet's like all there's RSA encryption. So it's so fundamental. It is the thing that holds.
And it's 3 guys' initials.
That I think
well, that's where it basically came from.
I think technically, I don't know. I might be hacking the history. I think this math goes all the way back to like pre-World War II. It's just a simple. You take 2 prime numbers. You do this math where it shoots out 2 big complicated numbers, and one could encrypt and one could decrypt. As long as you keep the decryption key, that's your private key. You could give everyone that public key, and they encrypt anything they want. I'm sorry, I just spit.
That's all right. I've done it several times.
They can encrypt whatever message they want, and you can only be with that key, that super long key that would take 1 and 70 zeros and how many years to decrypt to hack that key. So
okay,
as long as you hold that key, you're the only one that could decrypt that message. So RSA is kind of is that logic. There's a lot more to it. You take 2 prime numbers.
It sounds like that.
Yeah.
So that's something that you have to get bits of research. Basically, there's not really a single source where you're getting you got your information out of it. So it was from
sources. Many,
and then trial and error, I'm sure.
Yes,
too.
yes.
Interesting.
So in 2008, I didn't know about RSA encryption. I was like, no one could build a system like that. No, it doesn't compute in my head. I'm a programmer now, and I can't even understand how to program that, which is hilarious because at that time I was programming Yelp before Yelp was Yelp, like in 2002.
Wow.
So I was like,
look at it now.
Yeah.
Yeah.
In 2002, Yelp wasn't even out yet. I was actually passing out flyers for my business called Suggestion Finder, because Suggestion Finder, you're finding suggestions on restaurants or food.
Like Yelp.
Suggestionfinder.com.
Oh, you were there.
Yeah. 2 years later, Yelp came out and they're massive. So I gave up. But so I mean, my brain, my knowledge on programming I thought was fairly sophisticated. 2008, when my coworker is like, "What do you think?" I'm like, "Nope, not possible." Yeah.
And here we are.
If I would have put $20 in at that time, that would have bought me probably like 20. I don't even know. It would be worth probably $400 million right now. Maybe I don't know the math.
Ouch.
Yeah. If I would have just,
even if it was just 100.
Oh yeah. So embarrassing. That's the true story of 2008. Then 2016, my friend at a pool party, he was like the CIO's CTO, Chief Technology Officer at some company.
Heard that term before.
So I knew of him. I didn't know a lot about him. He walked up to me that day and he's like, "Hey, what do you think about cryptocurrency?" And I'm like, "What's that? Bitcoin, right?" And he's "Yeah, what do you think about it?" I'm like, "I don't really know that much about it." And he's "Well, take a look at Ethereum. That's the number." Or
Ethereum. That's one you mentioned earlier.
Yeah,
okay.
yeah. So that night I went home, I started researching it, and the light bulb went off. I'm like,
bing!
I fucking get it. I need to invest. Yeah. That was it. It got so much, I think, that a few months later, I told Em. I remember having lunch with Emmett one day. I was like, "Hey, I usually have rainy money in the bank. I call it rainy day money.
Yeah.
I have a set amount that I set aside in case of rainy day." And I told him, "Hey, I already been taking money and buying cryptocurrency, but I want to buy more. I want to use my rainy day money." And Emmett's like, "You probably shouldn't." That rainy day money probably would have been like $600,000 right now.
Damn it!
I don't.
And
I'm not upset.
No. It is what it is.
Yeah.
Very cool. Well, thanks for educating me on that.
Yeah. If you have questions,
really fascinating. Now I'm like really fascinated about it.
I
appreciate you taking the time to say that. So you probably should even do some layman's terms. Well, you're doing it right now.
Yeah.
But I don't know how many people want to watch teeth and then to get to you, but there's that little bar at the end where you can fast forward to listen to Liem. Interesting.
Between, I think, blockchain and AI are the two topics that really fascinate me, because AI, if it comes with Terminator attached to it, that's pretty bad for us. But if AI comes and automates everything, and we get, I think, in a utopian world, like AI, well, I guess that's how all the bad movies start out with AI.
Tron, like
iRobot,
and then Terminator.
Yeah.
Can you tell I'm a sci-fi nerd?
So those are the two. I hope AI is further, like, I hope it's not soon, or I don't know.
That it gets further advanced?
I don't know.
Yes and no.
Yes and no, exactly. I hope it's here, but then I don't hope it's here soon. I don't know.
If you knew the outcome was good, then 100%.
Exactly.
I hope it was there. Yeah. No, I get it. Interesting. Thank you.
No problem. Oh man, I burned a lot of time. We have 3 questions. Let's see if you could.
Okay.
If we could go through it quickly. What's the biggest problem nationally and or globally, and what should humans do to fix it?
I think humans.
Sorry, for time wise, it's mainly up to you. I think usually my roommates could. They're not too as in. Oh, we hit 3 hours already.
Okay.
So okay, no, as long if you need to go anywhere or anything.
No, I'm good.
Okay.
This has been a rough week. I took them like nothing on Friday.
Awesome.
As far as globally, I think before any issue is fixed, I think globally and nationally, Like people just need to learn to work with each other. Like egos need to get pushed aside. People with their, what's the word? They have their, they need to get out of their own heads and, look at people as people. We talked about it earlier, people with viruses and how people have a stigma about it. Like everybody needs to look at other races, everything, get out of their own heads and actually work together. Like there are institutions that can't even work together, corporations that can't work together. And then the corporations that do, they boom. Imagine if the world could do the same thing work on, there'd be so many things that would be resolved immediately. So I think people just, stop hating behind a computer for one, I think would make the world just an amazing place just doing that. But as far as issues, the racism and the political differences, all of that needs to be, and I'm not talking about our country, just our country, it's globally, it really is. And so, yeah.
I fully agree with you. There's a lot of things I could go on tangents, but I'm going to hold myself back.
The base of it is people just need to get their shit together and quit being, I
want to say, I don't know if divisiveness is, that's more new than, yeah. All right. All right. I don't want to go. Moving on. Think of at least one person that you know personally that should do this conversation. Call them out.
So probably be a couple of people.
Okay.
So there's, I've got a couple of favorite numbers people. They're like different levels. It's accounting, and they're in the upper hierarchy of it. That would be Melanie and Dave. Melanie, Dave. They're two very, very close friends of mine. I have a thing of being super close with people who are numbers people. I don't know what it is. I have this personality that's just, very not detailed. Well, when it comes to work, yes. But outside of that, it's just like, and not that they can't be, but I could see them making numbers in accounting so fascinating.
Okay. Awesome.
So she's like in the upper management, like she she's a badass bitch. Same with Dave, but for a guy, he's not a bitch. The other one would be an attorney that I know who is the most entertaining attorney who has found a way to do law from home, and just an amazing, entertaining guy. So that'd be Eduardo. Okay. I don't know if you know who Eduardo is. No. We have so many circles of friends that are, so I think but no. But Eduardo would definitely, for sure, Eduardo, you need to do this. So
awesome. Yeah. You guys are going to be contacted.
You're welcome.
Briefly describe your expectations before this conversation and your thoughts now that we're done. If you've done a podcast before, you could talk about the differences. I may use this video in a video collage for new potential guests.
Walking in, I don't know. I kind of know you, I've met you before, so I was very comfortable doing it. So my expectations were just, actually, I thought it was going to be a lot boring than it was. So it wasn't boring at all. It was actually fun. I was like, who really wants to know teeth? But I think your questions and the interaction, or actually not just about teeth, but about dental hygiene in general. I find it passionate. I feel no one else will, but I think there's some interest in there. But yeah, it made me think about a lot of things, how I chose my life plan, my career, my path, everything. So I had a great time. It was fun.
Awesome.
I'm glad I did it. Yes.
Awesome. Thank you so much.
You're very welcome. Thank you.